Hi. Hello. Hello, students. Good morning. Good morning. Good morning. Hi. Hello. Hello, students. Good morning. Good morning. Hi, Amit. So, good morning to all of you and welcome to this FMG Marathon series. Okay. Uh, so, let us start with anatomy. So, this will be a 3 hour session. Okay. And there will be lot to understand, lot to study, and you keep on interacting. Okay. Be interactive. So, it will be easy for me to teach and you to understand. Good morning to all of you. I'm fine. I'm fine. Okay, chalo, we'll start. We'll start. So, starting with the following topics which are very important from the exam point of view, we'll try to cover. Okay, so muscles, nerve supply, and the actions. If you can answer this, biceps brachii. What is the nerve supply? Chalo, come on. If you can answer this, whatever you feel you answer, even if it is wrong, ठीक है. Always attempt to answer. अगर गलती करते हो तो you will always remember this. ठीक है? So we begin here. I'm starting now. Let us start. Nerve supply of biceps brachii. चलो बताओ बच्चों. If you know. Hi Saida. Hi Dr. Rehana. Hi Yash. Amit. Can you adjust? Background noise is coming. Background noise आ रहा है. Okay. Now see. Fine. This is fine. Now fine. Sayed. Now you are here. Listen to this. Fine. Okay. So what is the nerve supply of biceps brachii? That's a musculocutaneous nerve. Musculocutaneous nerve, I'll just talk. आप बाद में इसको लिख सकते हो. Musculocutaneous nerve. What is the action of biceps brachii? It's a chief supinator. It's a chief supinator at the radial nerve joint. It's a chief supinator at the radial nerve joint. It's a flexor of the elbow. It's a flexor of the shoulder joint. Hi, Sayyid, fine. हाँ, अभी यहाँ पे concentrate करो. ठीक है? Just concentrate here. Okay, so nerve supply of biceps brachii, musculocutaneous nerve. The main action of biceps क्या होता है? It's supination at the radial nerve joint. Second action, flexion at the elbow joint, and third action is flexion at the shoulder joint. Flexion at the shoulder joint. Fine. Okay, बोल सकते हो nerve supply of deltoid. Okay, I'll just mention it here. Musculocutaneous nerve. बाद में उसका action आप लिख सकते हो. वैसे nerve supply of deltoid. Yes, anyone? Deltoid is axillary nerve. Very good. Deltoid is axillary nerve. Any other muscle supplied by the axillary nerve? एक तो वो deltoid supply करती है. Any other muscle supplied by axillary nerve? The teres minor. Correct? Teres minor. It gives a cutaneous branch. नाम है upper lateral cutaneous nerve of arm. So axillary nerve दो muscle supply करती है. One is deltoid. Second is teres minor. It gives a cutaneous branch. नाम है upper lateral cutaneous nerve arm. Injury to this nerve leads to loss of sensations here. नाम है रेजिमेंट बैच साइन. रेजिमेंट बैच साइन याद रखना बहुत इंपॉर्टेंट है. रेजिमेंट बैच साइन इज सीन इन लीशंस ऑफ एक्सिलरी नर्व. मसल सप्लाइड बाय एक्सिलरी नर्व, डेल्टॉइड एंड टेरेस माइनर. डेल्टॉइड, ये जो शेप है शोल्डर का, कॉन्टूर ऑफ द शोल्डर इज बिकॉज ऑफ डेल्टॉइड. अगर डेल्टॉइड पैरालाइज होता है तो शेप ऑफ द शोल्डर इज लॉस्ट. दिस इज व्हाट वी कॉल एज फ्लैट शोल्डर. सो दीज आर ऑल द एमसीक्यूज व्हिच कैन बी आस्क्ड on this topic. Fine. So we'll try to cover as much as possible. Fine. Serratus anterior. What is the nerve supply of serratus anterior? That's a long thoracic nerve, or the nerve of bell nerve to serratus anterior. Root value batao. Root value. Just tell me the root value of this. Smooth specialist. Okay, just tell me the root value. Root value of the nerve to serratus anterior, root value of long thoracic nerve is C5, C6, C7, C5, C6, C7 roots of the brachial plexus, right? C5, C6, C7 roots of the brachial plexus. Paralysis of serratus anterior results in winging of scapula, right? Paralysis of serratus anterior leads to winging of scapula. Very good, very good, very good. बहुत अच्छे से आंसर कर रहे हो. Okay, just maintain this speed, just maintain this till the end of the lecture. Rhomboids. What is the nerve supply of rhomboids? बोल सकते हो बच्चों, nerve supply of rhomboids. The long nerve supply of the rhomboids is dorsal scapular nerve, right? Dorsal scapular nerve, also known as nerve to rhomboids. Dorsal scapular nerve, उसका दूसरा नाम है nerve to rhomboids. Fine. Okay. What is the root value of nerve to rhomboids? Dorsal scapular nerve का root value is C5, root of the brachial plexus. The dorsal scapular nerve supplies the rhomboidus minor, rhomboidus major and the levator scapulae. तीन muscles को ये supply करता है, levator scapulae, rhomboidus minor, rhomboidus major. Can anyone tell me the action of rhomboids? Action of rhomboids. Yes, very good, very good. बहुत बढ़िया, बहुत बढ़िया. Action of rhomboids बताइए. What is the action of rhomboids? हाँ. Serratus anterior का action क्या है? Protraction of scapula. Protraction of scapula. What is the action of rhomboids? Retraction of scapula. इसका action is retraction of scapula, right? Retraction of scapula. इसका action क्या था? Serratus long thoracic nerve, serratus anterior का action क्या था? Protraction of scapula. Okay, very good. Inferior angulation, right? ठीक है? Correct. Climber's muscle. बोल सकते हो who's the climber's muscle? Students, climber's muscle is the latissimus dorsi. Very good. Climber's muscle is latissimus dorsi. Swimmer's muscle is serratus anterior. Swimmer's muscle है serratus anterior. Climber's muscle है latissimus dorsi. What is the nerve supply of latissimus dorsi? Yes, nerve supply of latissimus dorsi is the thoracodorsal nerve. Thoracodorsal nerve arises from which chord of the brachial plexus? Posterior chord of the brachial plexus. Thoracodorsal nerve, posterior chord of brachial plexus. Very good. So climber's muscle है latissimus dorsi. कहाँ से आता है ये? Posterior, the nerve supplies nerve to latissimus dorsi. Thoracodorsal nerve arises from the posterior chord of the brachial plexus. Perfect. Very good. Okay. Great, great. Very nice. चलो बच्चों बोलो व्हाट इज दिस ट्राइंगल. ये ट्राइंगल का नाम बताओ. ये ट्राइंगल के बाउंड्रीज है ट्रेपेजियस, latissimus dorsi and the medial border of scapula. What is the name of this triangle? हाँ, C6, 7, 8, right? C6, 7, 8 is nerve to latissimus dorsi. Perfect, perfect, perfect to all of you. What is the name of this triangle? Yes, any guesses? Just one moment. Yes, students. Hello, hello. What is the name of this triangle? That's a triangle of auscultation. Very good. Triangle of auscultation. इसके boundaries क्या है? Yes, that's a triangle of auscultation. हाँ, यहाँ पे इसको बोलते हैं triangle of auscultation. इसके boundaries देखिए. This is a trapezius. That's a latissimus dorsi. That's a medial border of scapula. This is a triangle of auscultation. इसका floor is formed by rhomboidus major. Rhomboidus major. Fine. Rhomboidus major forms the floor. That is triangle of auscultation. Boundaries पे MCQs आते हैं. You get MCQs on the boundaries of this triangle of auscultation. If you place the stethoscope here, the breath sounds are very clearly heard. अगर left side पे लगाते ही है, if you put the stethoscope on the left side, you can hear the gurgling sounds, okay, of the fluid going in the stomach. So it मतलब auscultation is very easy here. Sounds are felt very easily here. Okay, what is this? What is this triangle? ये क्या triangle है? Can you tell me this triangle? So ये है latissimus dorsi. That's a latissimus dorsi. That's an external oblique. The base is formed by the iliac crest. This is the Petit's triangle. The lumbar triangle of Petit's formed by external oblique latissimus dorsi. The floor is formed by the external oblique latissimus dorsi. The base is formed by the iliac crest. The floor is formed by internal oblique. ये जो floor है ना, that will be formed by internal oblique. ये hernia होता है यहाँ से, petit triangle. Hernia occurs here. Hernia occurs here. Fine. Abduction at the shoulder joint. बोल सकते हो abduction at the shoulder joint. Anyone? 0 to 15 degrees of abduction is done by whom? 15 to 90 is done by whom? And 90 and above. 90 and above. बोलो बच्चों. 0 to 15 degrees. कौन करता है abduction? Abduction at the shoulder joint. 0 to 15 degrees. इसको हम बोलते हैं initiation of abduction. Initiation of abduction. Who does this? Yes, students, come on. Supraspinatus. Excellent. 0 to 15 degrees is done by supraspinatus. That's initiation of abduction. 15 to 90 degrees is done by deltoid. Deltoid. And 90 and above is done by whom? Serratus anterior, trapezius, and the lateral rotation of scapula. The scapula turns like that, laterally rotates. Glenoid cavity ऊपर की तरफ जाता है. That is lateral rotation of scapula. Just remember, 0 to 15 degrees कौन करता है? Initiation of abduction is done by supraspinatus. 15 to 90 degrees कौन करेगा? Deltoid. And 90 and above, we call this as overhead abduction. This is done by trapezius, serratus anterior, and the wing and the rotation of scapula, the lateral rotation of scapula. Perfect. Very good. Excellent. चलो, rotator cuff muscles के नाम बताओ. Name the rotator cuff muscle. Which are the rotator cuff muscles? Any guesses? Rotator cuff muscles. आगे है subscapularis. हाँ, subscapularis. ऊपर है supraspinatus, infraspinatus, and teres minor. Teres minor. These are the rotator cuff muscles. आगे subscapularis. Subscapularis is in front. Above is supraspinatus. Behind is infraspinatus and teres minor. Very good, very good. Yes. Fine, clear. समझ में आ रहा है ना? This speed is fine. No, sits. Yes, sits. SITS. Very good. SITS. Correct. SITS. Perfect. चलो. Structures piercing the clavipectoral fascia. बोल सकते हो? A very important MCQ. Very important. Structures piercing the clavipectoral fascia. Yes. One is the cephalic vein. Cephalic vein. दूसरा. Yes. Structures piercing the clavipectoral fascia. One is cephalic vein. Second is thoracoacromial artery. Third is lateral pectoral nerve. Lateral pectoral nerve and lymphatics. Lymphatics from the breast. Lymphatics from the breast. So structures piercing the clavipectoral fascia. Cephalic vein, thoracoacromial artery, the lateral pectoral nerve and lymphatics from the breast. याद रखना, बहुत important MCQ है ये. Yes. Very good, very good. Laksha. Smooth specialist. अनुभव. Yes, very good. बहुत अच्छा आंसर कर रहे हो सब लोग. बहुत अच्छे से आंसर कर रहे हो. Good, good, good. Clear? So structures piercing the clavipectoral fascia. याद रखना. Branches of lateral cord, medial cord, posterior cord. चलो बच्चों बोलो. Branches of lateral cord. Let us start. 1. Lateral pectoral nerve. 2nd. Lateral root of median nerve. तीसरा, musculocutaneous nerve. Be very clear about this. Lateral pectoral, lateral root of median nerve, musculocutaneous nerve. 3. Branches of medial cord. Number 1, medial pectoral nerve. 2, medial root of median nerve. 3, medial cutaneous nerve of arm. 4, medial cutaneous nerve of forearm. 5, ulnar nerve. Ulnar nerve. So these are the branches of medial cord. Now you tell me, ulnar nerve is a branch of medial cord. But what is the root value of ulnar nerve? Anyone? Ulnar nerve is a root value of ulnar nerve is a branch of medial cord. Medial cord की root value है C8 and T1. But what is the root value of ulnar nerve? Can anyone tell me? Medial cord की root value क्या है? C8 and T1. Lateral cord की root value है C5, C6, C7. What is the root value of ulnar nerve? This is very important. Ulnar nerve is C7, C8 and T1. अल्नर नर्व की रूट वैल्यू होती है C7, C8, T1. मीडियल कॉर्ड की रूट वैल्यू है C8 एंड T1, बट अल्नर नर्व दो इट्स अ ब्रांच ऑफ मीडियल कॉर्ड, उसकी रूट वैल्यू है C7, C8, T1. तो नाउ यू टेल मी ये C7 फाइबर्स कहां से आते हैं? The C7 fibers comes from the lateral cord. C7 fibers come from the lateral cord. हाँ, ये याद रखना, हमेशा पूछते हैं MCQs में. Medial cord root value is C8, T1. Ulnar nerve is a branch of medial cord. उसकी रूट वैल्यू है C7, C8, T1. याद रखना. ये C7 fibers comes from lateral cord. ये lateral cord से आके join होते हैं. It comes from the lateral cord. Why smooth specialist? ठीक है. Posterior cord के branches. Posterior cord के branches. Upper subscapular, lower subscapular, axillary, nerve to latissimus dorsi, radial. Okay. Branches of posterior cord, upper subscapular nerve, lower subscapular nerve, axillary nerve, nerve to latissimus dorsi and radial nerve. Radial nerve. ठीक है. इसमें just tell me, जो upper subscapular, lower subscapular and axillary, इनकी रूट वैल्यू है C5, C6. The root value of this upper subscapular, lower subscapular, axillary is C5, C6. Nerve to latissimus dorsi, thoracodorsal nerve C6, 7, 8 and radial nerve C5 to T1. C5 to T1. Okay, ये sorry, ये इधर है. I'm so sorry. Branches of the posterior cord, upper subscapular, lower subscapular, axillary C5, C6. ये याद रखना. Posterior cord की रूट वैल्यू है C5 to T1. Posterior cord की रूट वैल्यू है C5 to T1, but out of this upper subscapular, lower subscapular, axillary, इनका रूट वैल्यू होता है C5, C6, C7. Long thoracic nerve C5, C6. I'm so sorry. C5, C6. Long thoracic nerve is C6, 7, 8 and radial nerve is C5 to T1. बस ये याद रखना. Just remember this. This you have to remember. हाँ, ये MCQs में आता है. Smooth specialist इतना भी difficult नहीं है. Just keep on revising. You will understand it. Fine. Branches from the roots of the brachial plexus बोल सकते हो. One is C5. That's a dorsal scapular nerve. And C5, C6, C7, that's the long thoracic nerve. Branches from the roots. Yes, branches from the roots. This is C5, that's dorsal scapular. Fine. And C5, C6, C7 is long thoracic. Long thoracic nerve. Fine. Fine. ये याद रखना. क्या बच्चे? एक्सप्लेन बाय विंगिंग ऑफ स्कैपुला. विंगिंग ऑफ स्कैपुला. अच्छा देखो क्या होता है ना, क्या होता है, serratus anterior है ना, serratus anterior comes and gets, अगर ये स्कैपुला, दिस इज माय स्कैपुला, दिस इज माय लेफ्ट स्कैपुला, serratus anterior आके यहाँ पे अटैच होता है, यहाँ पे on the costal aspect medial border. Serratus anterior comes and gets attached here. So when the serratus anterior is paralyzed, the medial border goes up like this. ऐसे ऊपर जाता है. Serratus anterior is going to pull the scapula towards the chest wall. वो ribs की तरफ खींचता है. When the serratus anterior is paralyzed, the medial border of scapula becomes prominent. That is winging of scapula. Fine. Okay, great. Branches of axillary artery. Branches of axillary artery. Come on students, branches of axillary artery, first part, second part, third part. वैसे axillary artery is divided into 3 parts by pectoralis minor muscle. Axillary artery को 3 parts में कौन divide करता है? Pectoralis minor. हाँ, ये याद रखना, pectoralis minor divides the axillary artery into 3 parts. From the first part, what is the branch? From the first part, superior thoracic artery. Second part के 2 branches हैं, lateral thoracic and thoracoacromial artery. lateral thoracic and thoracoacromial. अब थर्ड पार्ट के ब्रांचेस इज एंटीरियर सर्कमफ्लेक्स ह्यूमरल, anterior circumflex humeral, posterior circumflex humeral and subscapular artery. Anterior circumflex humeral, posterior circumflex humeral and subscapular. ये याद रखना बच्चों. Just remember this. Just remember this. Clear? So branch axillary artery is divided into three parts by the pectoralis minor. First part की एक branch है superior thoracic. Second part के दो branches है lateral thoracic and thoracoacromial. Third part के तीन branches है anterior circumflex humeral, posterior circumflex humeral and subscapular. Dorsal scapular subclavian artery की branch है बच्चे. अनुभव, dorsal scapular is a branch of subclavian, it's not a branch of axillary artery. No, वो subclavian artery की branch है. ठीक है बच्चे? Okay, fine. Clear to all of you? Right. What is a musculocutaneous nerve supply? Musculocutaneous nerve is a branch of the lateral cord. Musculocutaneous nerve is a branch of lateral cord. What does it supply? Musculocutaneous nerve तीन muscles को supply करती है. Biceps brachii, brachialis and coracobrachialis. Biceps brachii, brachialis and coracobrachialis. Musculocutaneous nerve is a branch of lateral cord of the brachial plexus. तीन मसल्स को सप्लाई करता है ये. बाइसेप्स ब्रेकाई, ब्रेकियालिस एंड कोराकोब्रेकियालिस. फाइन. एक्सिलरी नर्व मैंने बोल दिया आपको. एक्सिलरी नर्व दो मसल्स को सप्लाई करती है, डेल्टॉइड, टेरिस माइनर, एंड इट गिव्स अ क्यूटेनियस ब्रांच. नाम है अपर लैटरल क्यूटेनियस नर्व ऑफ आर्म. ओके, अपर लैटरल क्यूटेनियस नर्व ऑफ आर्म. अच्छा, बीबीसी. वेरी गुड, वेरी गुड. एक्सिलरी नर्व दो मसल्स को सप्लाई करती है. दिस यू रिमेंबर है, ये सब बहुत इंपॉर्टेंट है. डेल्टॉइड, टेरिस माइनर एंड एक क्यूटेनियस ब्रांच है अपर लेटरल क्यूटेनियस नर्व ऑफ आर्म. अपर लैटरल, हैंड में एंटीरियर, पोस्टीरियर, फुट में मीडियल लैटरल. ठीक है, फाइन. ओके, क्लियर टू ऑल ऑफ यू. कमिंग टू द नेक्स्ट, अपर ट्रायंगुलर स्पेस. अपर ट्रायंगुलर स्पेस, इसका डायग्राम मैं ड्रॉ करता हूँ. आई जस्ट ड्रॉ दिस डायग्राम फॉर यू. बोलो बच्चों, दिस इज द स्कैपुला. हाँ, दिस इज द डॉर्सल एस्पेक्ट ऑफ द स्कैपुला. ये है अपना ह्यूमरस. दैट्स आवर ह्यूमरस. टेल मी नाउ, व्हाट इज दिस मसल व्हिच बिगिंस फ्रॉम द इंफ्राग्लिनॉइड ट्यूबरकल एंड गोज टू द, what is this? That's a long head of triceps. That's a long head of triceps. What is this muscle which begins from the dorsal aspect of the scapula and ये पीछे की तरफ जाता है. हाँ, पीछे की तरफ on the greater tubercle. What's this? Teres minor. That's teres minor. And ये जो muscle है, it goes in front. ये आगे जाता है on the medial lip of the bicipital groove. ये कौन है? Teres major. Teres major. Fine. And what is this muscle? This is the latissimus. This is the triceps. ये है triceps. This is the long head of triceps. Long head of triceps. Fine. ये याद रखना. So teres minor, teres major, long head of triceps. You get three spaces here. यहाँ पे तीन spaces मिलते हैं. Fine. So you get three spaces. बोलो, what is this first space? ये first space क्या है? Upper triangular space. What is this space? That's a lower triangular space and this is the quadrangular space. याद रखना, upper triangular space के boundaries क्या है? Upper triangular space के boundaries are teres minor, teres major, long head of triceps. Lower triangular space के boundaries are teres major, long head of triceps, shaft of the humerus. Quadrangular space के boundaries are teres minor, teres major, long head and the neck of the humerus. Neck of the humerus. Fine. Okay, what are the contents of this space? Upper triangular space. What is this? Artery, circumflex, scapular artery. Upper triangular space is circumflex scapular artery. Lower triangular space से there's an artery and there's a nerve. एक artery, एक nerve है. बोल सकते हो? Can anyone tell me this? What is this? Radial nerve. Radial nerve and profunda brachii artery, radial nerve and profunda brachii artery, and ये कौन है? Axillary nerve and posterior circumflex humeral artery. Axillary nerve and posterior circumflex humeral artery. Just remember this. So be very clear about this. इस पे MCQs बहुत आते हैं. This is upper triangular space, ये है lower trianguल space, ये है quadrangular space. उसके boundaries याद रखना, contents याद रखना. Very good, very good. Fine है बच्चों, clear? Fine to all of you. समझ में आ रहा है? Yes. Okay. चलो proceed करते हैं. Let us proceed. Right. So I've told you the spaces around the arm. Now you tell me anatomical snuff box. ये anatomical snuff box है. What are the boundaries of anatomical snuff box? Boundaries बोल सकते हो anatomical snuff box के? Anyone? What are the boundaries of anatomical snuff box? देखो एकदम easy way से I'm telling you. A easy way to remember, that's the head of the radius, that's the neck of the radius, shaft of the radius, styloid process है ये, ulna, that's the styloid process of ulna. अब बोलो what is this muscle which begins from radius and ulna? ये कौन है? Abductor pollicis longus. A muscle which begins from the radius alone, extensor pollicis brevis. Abductor pollicis longus and extensor pollicis brevis, they go together. ये दोनों साथ में जाते हैं. Extensor pollicis longus, यहाँ पे एक मसल है extensor pollicis longus, it goes alone. So ये बन गया snuff box. बस ये याद रखना है आपको. So what are the boundaries of the lateral boundary of the snuff box? ये दो muscles बनाएंगे, abductor pollicis longus and this is extensor pollicis brevis. दो muscles. The medial boundary is formed by extensor pollicis longus. The floor कौन बनाता है? Styloid process of radius and two carpal bones, scaphoid and trapezium. Scaphoid and trapezium plus ये styloid process. ठीक है. फ्लोर में दो टेंडेंस आते हैं. These are the tendons of ECRL and ECRB. So फ्लोर कौन बनाता है? Styloid process of radius, scaphoid and trapezium. ये फ्लोर बनाएगा. फ्लोर के ऊपर दो टेंडेंस होते हैं. There are two tendons on the floor, ECRL and ECRB, extensor carpi radialis longus and brevis. Content बोल सकते हो? Content of this snuff box. Content कौन है? Radial artery. Content is the radial artery. And who lies in the roof? Roof में कौन है? हाँ बोलो बच्चों, come on. Content is radial artery. Roof में है cephalic vein and superficial branch of radial nerve. ये रूफ में आ गया. Cephalic vein and superficial branch of radial nerve, ये रूफ में आ गया. हाँ, base of the first, base इतना नहीं आता बच्चे, base ज्यादा नहीं आता उसमें. हाँ, styloid process, scaphoid and trapezium है. base बहुत कम आता है उसमें. ठीक है. So radial artery is the content. ये हो गया उसका roof and ये हो गया उसके boundaries, floor. ठीक है बच्चों, anatomical snuff box is done. हाँ, very good, excellent, बहुत अच्छा आंसर कर रहे हो. Very good. You'll definitely get good results. Yes. Basic, I mean, basic sciences, if it is clear, no, then student always exceeds. Okay, great. Chalo, great. Now, what are the contents of cubital fossa? Cubital fossa के contents बोल सकते हो MBBR, ये तो सबको पता है. M, median nerve, B, brachial artery, again B, tendon of biceps, R, the radial nerve. Radial nerve बोलो, superficial branch of radial nerve बोलो, anything is fine. Okay, so contents of cubital fossa, MBBR. You must be knowing this. Fine, chalo, very good. Muscle supplied by median nerve in the forearm and the hand. Yes, muscle supplied by median nerve in the hand. देखते हैं, hand. That is very important. बोल सकते हो, there are 5 muscles supplied by median nerve in the hand. कौन है? 5 muscles supplied by median nerve in the hand. Yes, first abductor pollicis brevis, flexor pollicis brevis, इसका superficial head, opponens pollicis, first and second lumbrical. First and second lumbrical. बस ये याद रखना. Muscle supplied by medial nerve in the hand, abductor pollicis longus, abductor pollicis brevis, flexor pollicis brevis का superficial head, opponents pollicis, the first and the second lumbrical. ये याद रखना, ये हमेशा पूछता है. Muscle supplied by medial nerve in the hand. Fine. Now coming to the muscle supplied by ulnar nerve in the hand. Yes. Abductor digiti minimi brevis, flexor digiti minimi brevis, opponents digiti minimi, third and fourth lumbricals. Third and fourth lumbricals. Then 4 palmar interossei, 4 palmar interossei, 4 dorsal interossei, adductor pollicis, and the deep head of flexor pollicis brevis. ये superficial head, ये supply करती है medial nerve. The deep head is supplied by ulnar nerve. Deep head is supplied by ulnar nerve. So 15 muscles supplied by the ulnar nerve in the hand: abductor digiti minimi brevis, flexor digiti minimi brevis, opponents digiti minimi, third and fourth lumbricals. Yes, 4 palmar interossei, 4 dorsal interossei, adductor pollicis and deep head of flexor pollicis brevis. अब इसमें से tell me which is the graveyard of ulnar nerve. Graveyard of ulnar nerve. मतलब ulnar nerve goes and ends in this muscle. Graveyard of ulnar nerve. बोलिए. Anyone? Graveyard of ulnar nerve is anyone? Anyone? Graveyard of ulnar nerve. हाँ नहीं hypothenar muscle नहीं, एक ही muscle है वो. That's adductor pollicis. Adductor pollicis is known as graveyard. Graveyard समझते हो? Graveyard of ulnar nerve. मतलब ulnar nerve goes and ends. उसके अंदर जाके खत्म. It ends in this muscle. The ulnar nerve dies in this muscle. It ends in this muscle. So adductor pollicis is known as the graveyard of ulnar nerve. बस याद रखना. ठीक है? That's it. चलो बच्चों. ये policeman stiff hand, ये आपको पता है. Erb's paralysis, policeman stiff hand, or the porter's stiff hand. Tell me what is this? ये क्या है बोलो? ये condition. What is this condition? Number 2 I'll put, number 3 I'll put, and number 4 I'll put. What is this condition? 3. What is this condition? Look at that. बताओ. चलो बच्चों, come on, answer this. What is 2, 3 and 4? Clinical condition. Spots, come on. देख के identify कर सकते हो. You can see the slide and quickly tell me what is this clinical condition. Wrist drop. Very good. Number 2 is wrist drop. Wrist drop. हाँ. Claw hand. Yes, claw hand भी बोल सकते हो. Claw hand है. Yes, but mainly it is wrist drop. Wrist drop है. Claw hand भी दिख रहा है उसमें. हाँ, ठीक है. Claw hand भी दिख रहा है. Yes. What is 3? What is 3? What is number 3? Colles fracture. नहीं, it's claw hand बोलो या फिर wrist drop. That's fine. What is this? You can see the shape of the shoulder here, and यहाँ पे shape देखिए shoulder का. मैंने आपको बताया, this rounded shape of the shoulder is lost. Shoulder drop नहीं बोलते उसको. Shoulder drop नहीं है अनुभव. No. The rounded shape of the shoulder, ये कौन से muscle की वजह से है? Which muscle gives this rounded shape to the shoulder? Deltoid. And if this deltoid is paralyzed, the shape of the shoulder is lost. इसे हम बोलते हैं flat shoulder. ये है flat shoulder. देख रहे हो? Bone दिख रहा है ना इसमें? You can see the bone here. So इसे हम बोलते हैं flat shoulder. Paralysis of which muscle? Deltoid. Nerve involved? Axillary nerve. Yes. Nerve involved is axillary nerve. Dislocate नहीं है बच्चे. Nerve involved is axillary nerve. It's a paralysis of deltoid. So nerve injured axillary nerve. क्या हो सकता है? Fracture of the surgical neck of humerus हो सकता है. अब paralysis भी हो सकता है. Anything. Fine. Regimen badge sign will be a associated symptom. What is this? Number 4. ये बोल सकते हो ये क्या है? देखिए, the person is, हाँ, ये बोल सकते हो winging of scapula. That's a winging of scapula. Yes, that's a winging of scapula. Okay, एक मिनट, I'm not able to see the comments. Fine, winging of scapula. Okay, fine. Coming to the next. अच्छा, ये वापस wrist drop है. What is this? You tell me. ये क्या लग रहा है आपको? What is this? This is a characteristic wrist drop. ये characteristic wrist drop है. What is this? Long thoracic nerve injury. Fine, स्वप्नेश, बहुत अच्छे. ये क्या है? ये क्या हुआ है? यहाँ पे देखिए, यहाँ पे ये जो thenar eminence देखिए, just see the thenar eminence here and see the thenar eminence here. There's a flattening of the thenar eminence. So that's an injury to the median nerve. Median nerve injury होगी, the thenar eminence is flattened. That's a thenar atrophy. तो ये हो सकता है carpal tunnel syndrome या फिर injury to the median nerve. You can say that's thenar atrophy. Median nerve injury. Yes, Lakshya. Fine, good. Chalo, coming to the next. Very good. Action of Sartorius बोल सकते हो बच्चों. Sartorius is the longest muscle in the body. What is the action of Sartorius on the hip joint? Sartorius को हम बोलते हैं honeymoon muscle. Honeymoon muscle is Sartorius. Actions of Sartorius. Yes, any guesses? बोलो. Very important MCQ. Actions of Sartorius is abduction, flexion and lateral rotation. Abduction, flexion and lateral rotation at the hip joint. Flexion and medial rotation at the knee joint. So abduction, flexion and lateral rotation at the hip joint. Any difference in muscle damage in winging of scapula seen normally and on flexion? हाँ बच्चे, हाँ मतलब सी एक मिनट हेलो स्टूडेंट्स, एक मिनट सुनो. सी, winging of scapula है. अब winging of scapula is caused due to paralysis of two muscles. दो muscles की paralysis की वजह से winging of scapula हो सकता है. Number 1 is the trapezius. Number 2 is the serratus anterior. मतलब two muscles paralysis leads to winging of scapula. Remember this: serratus anterior, trapezius. अब how are we going to differentiate? कैसे differentiate करेंगे whether this is because of winging is because of trapezius paralysis, serratus anterior paralysis? कैसे हम identify करेंगे? Tell the person to go and push the wall. Push the wall. मतलब when a person attempts a movement, जब कोई movement attempt करेगा and there is winging of scapula, that is serratus anterior. मतलब winging on attempting movement, serratus anterior paralysis, and the person is just sitting, बस ऐसे बैठा है at rest and there is winging of scapula, that's due to paralysis of trapezius. ठीक है, feet में dog clear है? मतलब winging on movement, serratus anterior, winging at rest, trapezius. याद रखिए. Yes. चलो. So Sartorius muscle का एक्शन है बच्चे. लक्ष्य 3 एक्शन है, उसके 3 एक्शंस हैं: abduction, lateral rotation, flexion at the hip joint, flexion and medial rotation at the knee joint. Sartorius को हम बोलते हैं honeymoon muscle. Fine, याद रखिए. Taylor's muscle, honeymoon muscle, that's Sartorius. Abduction, flexion, lateral rotation at the hip, flexion and medial rotation at the knee joint. Fine है? Okay, very good. Femoral triangle के boundaries ही बोल दो बस. Femoral triangle के boundaries, can anyone tell me the boundaries of femoral triangle? What are the boundaries of femoral triangle? Lateral boundary, medial boundary, So lateral boundary is formed by whom? Sartorius. Medial boundary is formed by the adductor longus. Medial boundary is formed by adductor longus. The base is formed by inguinal ligament. Inguinal ligament. So femoral triangle के boundaries medially is, yes, very good. Medially is adductor longus. Laterally is the sartorius. The base is formed by the inguinal ligament. Inguinal ligament. So that these are the boundaries of femoral triangle. बस उतना ही है. Obturator nerve. बच्चे, this is very very important. हाँ, femoral ring बोलता हूँ. Femoral ring is very important. ये देखिए. This is the femoral sheath. How do I draw this? एक मिनट बच्चों, just see this. ये femoral sheath है. इसमें 3 compartments होते हैं. That's a femoral sheath. There are 3 compartments in the femoral sheath. The medial compartment, this is known as the femoral canal. The upper part, इसे हम बोलते हैं femoral ring. What are the boundaries of femoral ring? बोल सकते हो, this is 1, this is 2, this is 3, and this is 4. 4. Boundaries of femoral ring. बच्चों, this you should know. This you should know. Floor is formed by iliacus, psoas major, pectineus, and adductor longus. अनुभव. Femoral ring के boundaries बताओ. चलो, what are the boundaries of femoral ring? Number 1 is the inguinal ligament. Inguinal ligament. Number 2 is the lacunar ligament. Lacunar ligament. 3 pectinate ligament. Pectinate ligament. And 4 is the septum. Septum separating it from the femoral vein. यहाँ पे कौन है? That's a femoral vein here. That's a femoral vein. यहाँ पे कौन होता है? Femoral artery plus the femoral branch of genitofemoral nerve. Femoral branch of genitofemoral nerve. So femoral sheath के 3 compartments है. The lateral compartment में कौन है? Femoral artery and the femoral branch of genitofemoral nerve. Intermediate compartment में होता है femoral vein. The medial compartment is empty. इसे हम बोलते हैं femoral canal. Upper part of femoral canal is the femoral ring. उसके boundaries हैं anteriorly inguinal ligament, medially lacunar ligament, posteriorly is the pectinate ligament, and laterally is the septum separating it from the femoral vein. याद रखना. This femoral ring is closed by a lymph node. What is this lymph node of? Cloquet or Rosenmuller. Rosenmuller. What does it drain? What does it drain? ये क्या drain करता है? Lymph node of Cloquet or Rosenmuller. It drains the glans penis and glans clitoris. याद रखना. Lymph node of Cloquet drains the glans penis and glans clitoris. ये deep inguinal lymph node है. The entire penis and the clitoris is going into the superficial inguinal lymph nodes. But normally penis and clitoris is draining into the superficial inguinal lymph nodes. The glans penis and glans clitoris drains into the deep inguinal lymph node. That's a lymph node of Cloquet. Remember, very important. Okay, that's a lymph node of Cloquet or Rosenmuller. Fine, coming to the next. Okay. Obturator nerve. बच्चे obturator nerve बोल सकते हो? Obturator nerve के boundaries बोल सकते हो? What are the boundaries of obturator nerve? I mean, what are the muscles supplied by the obturator nerve? Can anyone tell me this? Yes, students? What are the muscles supplied by the obturator nerve? Any guesses? Muscle supplied by obturator nerve. Oh, one moment. So obturator nerve के 2 divisions है, anterior and posterior division. याद रखिए, anterior division and posterior division. What is the anterior division supply? Adductor longus, adductor brevis, brachialis, and pectineus. The posterior division supplies the adductor magnus and obturator externus. Adductor magnus and the obturator externus. Fine. So just remember this. Anterior and posterior division of obturator nerve. बस ये याद रखना, हमेशा एमसीक्यूज में आता है. एंटीरियर डिवीजन सप्लाइज एडक्ट longus brevis, gracialis, pectineus, and posterior division supplies the adductor magnus and the obturator externus. Okay, fine. Chalo, see this. See the next. So this is fine. Now coming to the hamstring muscle. बच्चों नाम बोल सकते हो hamstring का? Come on, name the hamstring muscles. Name the hamstring muscles. Name the hamstring muscles. Come on, come on, come on. Name the hamstring muscles. जल्दी से जल्दी से जल्दी से hamstring muscles के नाम बोलो. Quadriceps नहीं है बच्चे. Quadriceps is different. Hamstring is different. Hamstrings के नाम semimembranosus, semitendinosus, biceps femoris and adductor magnus. Hamstring muscles याद रखिए. Hamstring muscles के नाम याद रखना. This is semitendinosus, semimembranosus, biceps femoris and adductor magnus muscle. पीछे होता है ना hamstrings. पीछे. What is the action of hamstrings? Extension at the hip and flexion at the knee joint. बच्चे quadriceps femoris अलग है. Quadriceps is rectus femoris, vastus medialis, vastus lateralis, vastus intermedius. वो quadriceps femoris है. Anterior compartment of the thigh is quadriceps femoris and sartorius. Nerve supply femoral nerve. Medial compartment is obturator nerve. Posterior compartment is sciatic nerve. इसका nerve supply is tibial part of sciatic nerve. Gluteus maximus. हाँ, very good अनुभव. चलो बोलो gluteus maximus का actions बोल सकते हो बच्चों. This is extremely important. Come on, take this. Actions of gluteus maximus. हाँ, अब when you stand up from a sitting position, आप बैठे हो and when we stand up from a sitting position, that's gluteus maximus. Actions बताओ. Gluteus maximus के actions. This will come in the exams. Come on बच्चों, answer this. Actions of gluteus maximus. It's a chief extensor at the hip joint. Chief extensor at the hip joint. Second is abductor and तीसरा है lateral rotator at the hip joint. Main action of gluteus maximus होता है extension at the hip joint. दूसरा action is lateral rotation. तीसरा है abduction at the hip joint. Main is extension. बाकी उसके accessory actions है abduction, lateral rotation. Nerve supply of gluteus maximus. Nerve supply. Nerve supply. Come on, बच्चों. This should be on the tip of your tongue. Nerve supply of gluteus maximus. Come on, come on, come on. If you can answer this, that's an inferior gluteal nerve. Inferior gluteal nerve. Nerve supply of gluteus maximus is inferior gluteal nerve. Fine. Okay. Now coming to the gluteus medius and minimus. Yes. Inferior gluteal nerve. Fine. What is the action of gluteus medius? Gluteus medius का main action is abduction, and minimus is medial rotation. अगर gluteus medius पूछते हैं main action of gluteus medius तो abduction. It is a powerful abductor. Minimus का action पूछता है तो it is a medial rotator. But साथ में when we talk about both these muscles together cause abduction, medial rotation, and they support the pelvis when one foot is off the ground. They support the pelvis when one foot is off the ground. मतलब if I lift my right foot, मैं दोनों पैर पे खड़ा हूँ, I'm standing on two legs. If I lift my right foot, तो right side का pelvis गिर जाएगा ना नीचे. The right side pelvis will drop. The left gluteus medius and minimus, they support the pelvis. मतलब when my right foot is off the ground, the left gluteus medius and minimus are active. So what is the action of gluteus medius and minimus? They support the pelvis when one foot is off the ground. अगर gluteus medius and minimus paralyze होते हैं, तो when I lift my right foot, the pelvis will drop on the right side. अगर left paralysis होते हैं. Next step is normal. Again, the pelvis will fall on the right side. ये gait को क्या बोलते हो? What is this gait known as? Yes, very good. The sign is known as Trendelenburg sign. Sign को बोलते हैं Trendelenburg sign. Gait को क्या बोलते हो? Gait. The gait is known as lurching gait. Lurching. अगर दोनों paralyzed है, दोनों साइड्स के पैरेलल हैं, इट इज नोन एज अ वैडलिंग गेट, अ डक गेट, वैडलिंग गेट. Fine. So what is the action of gluteus medius and minimus? Abduction, medial rotation, and support the pelvis. Support the pelvis when one foot is off the ground. One foot is off the ground. Yes, very good. Very good. बच्चों, बाकी के बच्चों आंसर करो. The rest of you can also answer. Yes, come on. So what is the nerve supply? What is the nerve supply of gluteus medius, gluteus minimus, एंड टेंसर फेशिया लाटा? ये PYQ है, ये PYQ है, बहुत बार पूछा गया है, बहुत बार पूछा गया है. नर्व सप्लाई ऑफ ग्लूटियस मीडियस, मिनिमस एंड टेंसर फेशिया लाटा. इट विल ड्रॉप ऑन द ऑपोजिट साइड. बच्चे, ऑपोजिट साइड. अगर लेफ्ट ग्लूटियस मीडियस एंड मिनिमस पैरेलल है ना, तो when the right foot is off the ground, opposite side है. मतलब ऐसे ऐसे याद रखना. See, you're standing on two legs. You lift your right foot को उठाया तो pelvis का support गया. The support of the pelvis on the right side is gone. The pelvis should fall on the right side. But ऐसे नहीं होता, because the left side gluteus medius and minimus contract. So when the left gluteus medius and minimus are paralyzed, the pelvis will drop to the right side. Opposite है, opposite. अनुभव, नाम बोलो ना, नाम, नर्व का नाम बोलो. व्हाट इज द नर्व, नेम ऑफ द नर्व? नेम ऑफ द नर्व. नर्व सप्लाई ऑफ ग्लूटियस मीडियस, मिनिमस एंड टेंसर फेशिया लाटा. बच्चों, दिस यू शुड नो. यह है सुपीरियर ग्लूटियल नर्व. सुपीरियर ग्लूटियल नर्व. सुपीरियर ग्लूटियल नर्व. So superior gluteal nerve supplies the gluteus medius, minimus and tensor fascia lata. Yes. बहुत बार पूछा गया है. That's a PYQ. Just remember that. Can anyone tell me the key muscle of the gluteal region? Key muscle, K-E-Y, key muscle of the gluteal region. ऐसा ना pear-shaped muscle होता है. It's a pear-shaped muscle and there's a big nerve जो इसके नीचे आती है. There's a big nerve which comes below this muscle. अगर ये muscle मिलता है, if you get this muscle, you get everything in this region. सब कुछ मिल जाता है in the gluteal region. अगर ये muscle मिलता है तो this muscle is known as the KEY, key muscle of the gluteal region. Anyone? It's a pear-shaped muscle. नाम बताओ. Key muscle of the gluteal region is piriformis. Very good. Piriformis. Yes. Key muscle of the gluteal region is piriformis. Piriformis. Yes. याद रखिए. That's very important. ठीक है बच्चों. Are you able to follow this, all of you? Yes. This speed is fair enough. Okay. Piriformis. एक मिनट. I'll just make a table for you. एक टेबल बनाता हूँ. Just remember this table. वैसे लेग के 3 कंपार्टमेंट्स होते हैं. One is a posterior compartment, one is an anterior compartment and one is a lateral compartment. ठीक है. अब lateral compartment, which are the muscles here? Muscles का नाम बोल सकते हो. That's peroneus, longus and peroneus brevis. Peroneus, longus and brevis. The nerve of this compartment, nerve का नाम superficial peroneal nerve. Nerve is superficial peroneal nerve and artery is peroneal artery. It's a branch of posterior tibial. ये MCQ है. Peroneal artery is a branch of, your answer, posterior tibial. It's a branch of posterior tibial. So lateral compartment of legs, simple, बहुत easy. Peroneus longus, peroneus brevis. Nerve has superficial peroneal nerve. Artery है peroneal artery. It's a branch of posterior tibial artery. Action of the muscles of the lateral compartment is eversion of the foot. Eversion of the foot. Simple. याद रखिए. Just remember this. इतना याद रखना. This is very important. चलो. Anterior compartment के muscles बस आप बता सकते हैं. Anterior muscle. That's tibialis anterior. Tibialis, tibialis anterior, extensor hallucis longus, extensor hallucis longus, extensor digitorum longus and peroneus tertius. Peroneus tertius. Okay, tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius. Nerve is the deep peroneal nerve. Nerve कौन है ये कंपार्टमेंट का? deep peroneal nerve. Artery is anterior tibial artery. So nerve of the anterior compartment is deep peroneal nerve. Artery है anterior tibial artery. अगर ये deep peroneal nerve is damaged, हाँ, what is the action of the muscles of the anterior compartment? Dorsiflexion. Dorsiflexion. If this deep peroneal nerve damage होती है, dorsiflexion is lost, the foot goes down. What is that? Foot drop. Foot drop. Understanding? So nerve is deep peroneal nerve, तो foot drop हो जाता है if this nerve is damaged. Action याद रखना and then understand the effects of injury. Fine. चलो कमिंग टू द पोस्टीरियर कंपार्टमेंट. पोस्टीरियर कंपार्टमेंट बड़ा है, इसमें दो टाइप्स ऑफ मसल्स है. वन इज द सुपरफिशियल मसल, वन इज द डीप मसल. सुपरफिशियल में गैस्ट्रोक्नीमियस, सोलियस, प्लांटारिस एंड चौथा है पॉप्लिटियस. एक्शन ऑफ पॉप्लिटियस बोल सकते हो? एक्शन ऑफ पॉप्लिटियस, कम ऑन स्टूडेंट्स, आंसर दिस. एक्शन ऑफ पॉप्लिटियस बहुत इंपॉर्टेंट है, बहुत इंपॉर्टेंट है बच्चों. ये ऐसे है ना, ऐसे टेबल से याद रखिए. रिमेंबर द टेबल्स, रिमेंबर द नर्व, रिमेंबर द आर्टरी एंड एक्शंस याद रखना. सो सब एमसीक्यूज आ जाएंगे आपको. यू विल अंडरस्टैंड, यू विल बी एबल टू आंसर ऑल द एमसीक्यूज. राइट, कम ऑन बच्चों. एक्शन ऑफ पॉप्लिटियस, एक्शन ऑफ पॉप्लिटियस, वेरी इंपॉर्टेंट, वेरी इंपॉर्टेंट. एक्शन ऑफ पॉप्लिटियस, कोई बोल सकता है एक्शन ऑफ पॉप्लिटियस? हाँ अनुभव, क्या बोल रहे हो? एक्शन ऑफ पॉप्लिटियस, अल्बाट्रॉस, अल्बाट्रॉस. हाँ बोलो अमित, बोलो 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 बच्चों. दिस यू शुड नो, ये सबको आना चाहिए, ये सबको आना ही चाहिए. और कौन है? अक्षय, बोलो बच्चे. स्नेहर, गोयल, नहीं पता? अरे बच्चे, एक्शन ऑफ पॉप्लिटियस इज अनलॉकिंग ऑफ द नी जॉइंट. दिस यू शुड नो. एक होता है लॉकर ऑफ द नी जॉइंट, जो नी जॉइंट को लॉक करता है, एक नी जॉइंट को अनलॉक करता है. सो पॉप्लिटियस क्या करता है ना, पॉप्लिटियस का एक्शन इज अनलॉकिंग ऑफ द नी जॉइंट. वेरी गुड, दीपक ने आंसर किया. ये अनलॉकिंग ऑफ द नी जॉइंट, दैट्स द एक्शन ऑफ पॉप्लिटियस. वेरी गुड. हाँ, yes, yes, अमित, स्टेबलाइज द नी, दैट्स फाइन, बट अनलॉकिंग ऑफ नी जॉइंट ये याद रखना. अगर पॉप्लिटियस अनलॉकर है तो who's a locker? तो कोई लॉकर भी तो होना चाहिए. There must be some locker of the knee joint. The one who's going to extend the knee joint, तो knee joint को extend करेगा, वो लॉकर होगा. Who's an extensor of the knee? Come on. Very good, very good. Who's a locker? Who's an extensor of the knee? वो लॉक करता है knee को. That's a quadriceps femoris. याद रखना बच्चे, quadriceps femoris is a locker of the knee joint. Unlocker is popliteus. Right? Remember this. That's very important. Yes. चलो, let us proceed. Deep muscles हैं tibialis posterior, tibialis posterior, flexor hallucis longus, flexor digitorum longus. Tibialis posterior, flexor hallucis longus, flexor digitorum longus. Fine. What is the nerve of this compartment? इसकी nerve है tibial nerve. Tibial nerve. Artery है posterior tibial artery. So nerve of this compartment is the tibial nerve. The artery is posterior tibial artery. बस ये table याद रखना. Everything will be easy. Everything. सारे MCQs answer कर पाओगे. So बच्चे, can you tell me foot drop is due to injury to which nerve? Foot drop. Foot drop is injury to which nerve? बहुत कॉमन है, कॉमन पेरोनियल नर्व. कॉमन पेरोनियल नर्व वाइंड्स अराउंड द नेक ऑफ द फिबुला. ठीक है ना? नेक ऑफ द फिबुला को हु वाइंड्स? कॉमन पेरोनियल नर्व. जब लाठी चार्ज होता है, लाठी चार्ज, हु इज इंजर्ड? कॉमन पेरोनियल नर्व इज इंजर्ड. जैसे कॉमन पेरोनियल नर्व इंजर्ड होती है, सुपरफिशियल एंड डीप बोथ आर इंजर्ड, सो दैट रिजल्ट्स इन अ फुट ड्रॉप. राइट? सो एक सिलेक्ट करना है तो डीप पेरोनियल नर्व है, बट डीप पेरोनियल नर्व की इंजुरीज आर वेरी रेयर. So which nerve when injured leads to foot drop? Common peroneal is your first answer. अगर common peroneal nerve option में नहीं है, then answer it as deep peroneal nerve. डीप पेरोनियल नर्व इज द फर्स्ट आंसर बच्चे, बट डीप पेरोनियल नर्व इंजुरीज बहुत रेयर होते हैं बिकॉज इट्स अ डीप नर्व. बहुत कॉमनली इंजर्ड नर्व कौन है? कॉमन पेरोनियल नर्व. कॉमन पेरोनियल नर्व वाइंड्स अराउंड द नेक ऑफ द फिबुला. वहां पे अगर फ्रैक्चर होता है तो कॉमन पेरोनियल नर्व इज इंजर्ड. हाँ ठीक है बच्चे, याद रखना. सो प्रायोरिटी कॉमन पेरोनियल, इफ नॉट देन डीप पेरोनियल हमेशा. Okay, now coming to here, tendon which winds around the medial malleolus. बच्चों, come on, one sentence, एक sentence का आंसर है, one word का आंसर है. Tendon which winds around the medial malleolus. मतलब, what is the meaning of this? What is the meaning of this? ये medial malleolus है, that's a medial malleolus, and there's a tendon which goes around the medial malleolus. कौन है? Any guesses? हाँ बच्चे, sciatic nerve के branches. Okay, anything for you. चलो, एक फटाफट. Sciatic nerve divides into a tibial nerve, एक मिनट, tibial nerve and a common peroneal nerve. Tibial nerve कहाँ जाती है? Posterior compartment में जाती है. Posterior compartment of the leg में गई tibial nerve. Common peroneal nerve divides into a superficial peroneal nerve and a deep peroneal nerve. Deep peroneal nerve goes to anterior compartment. Superficial peroneal nerve goes to the lateral compartment. खत्म बच्चे, खत्म, done. ठीक है. So sciatic nerve divides into a tibial and common peroneal. Common peroneal nerve is very commonly injured. बच्चे, the nerve which is injured is common peroneal nerve. Why? It winds around neck of the fibula. याद रखना, neck of the fibula. ये MCQ आता है. The nerve which winds around the neck of the fibula is common peroneal. वहां पे इंजरी होती है. So दोनों गए. Superficial भी जाता है, deep is also gone. Both nerves are gone. So the person will get foot drop. Eversion is lost. So inversion होता है. Foot drop भी होता है, inversion भी होता है. Fine. Okay, answer this now. Tendon which winds around the medial malleolus. Come on, students. This you should know. This you should know. So the tendon which hooks around the medial malleolus is tibialis posterior. याद रखना ये. So the muscle which winds around the medial malleolus is tibialis posterior. Chief insertion on navicular tuberosity is tibialis posterior. ये कुछ important MCQs है. ये बहुत important MCQs है. Groove below the cuboid bone. This is for the peroneus longus. ये सिंगल वर्ड MCQs है. सिंगल वर्ड MCQs, हाँ. Peroneus longus. Fine. Just remember. And the muscle winding around the medial malleolus is tibialis posterior. Tibialis posterior. Around the lateral malleolus is peroneus brevis. So muscle जो medial malleolus को wind करती है वो है tibialis posterior. जो lateral malleolus को wind करेगा वो होगा peroneus brevis, not longus, brevis. याद रखिए. ठीक है बच्चों. बस लेयर ऑफ सोल है ना. लेयर्स ऑफ द सोल में बोलता हूं आपको क्विकली. लेयर्स ऑफ द सोल कैसे याद रखोगे? देखो, दिस इज द ग्रेट टो. ये ग्रेट टो हो गया, ये लिटिल फिंगर हो गया. लिटिल फिंगर. ग्रेट टो को क्या बोलते हैं? व्हाट डू यू कॉल द ग्रेट टो? एज हेलक्स. ये क्या था? पॉलिक्स. ग्रेट टो इज द हेलक्स. लिटिल फिंगर डिजिटा मिनिमाई. सेम. लिटिल फिंगर डिजिटा मिनिमाई. ग्रेट टो को हम बोलते हैं हेलक्स. हेलक्स, हेलक्स. सो कितने लेयर्स हैं? देयर आर 4 लेयर्स इन द सोल. हाँ, 4 मस्कुलर लेयर्स होते हैं सोल में. बस बच्चे जितना मैं बोल रहा हूं उतना ही याद रखना, उतना ही पूछते हैं. जस्ट रिमेंबर दिस मच. हाँ, नहीं तो लेयर्स ऑफ सोल नथिंग much to remember. Just remember what I'm telling you. There are 4 layers in the soul. 1, 2, 3, 4. The first and the third layer are small muscles. First and the third layer छोटे muscles होते हैं. This will end with brevis. ये brevis में end होता है. कैसे याद रखोगे? Put an abductor here. So this is abductor hallucis brevis. Put an abductor here. Abductor digiti minimi brevis. And बीच में एक flexor डाल दो. Flexor digitorum brevis. Flexor digitorum brevis. कैसे याद रखोगे इसको? एबडक्टर एबडक्टर बीच में फ्लेक्सर, फ्लेक्सर हालुसिस ब्रेविस, फ्लेक्सर डिजिटम मिनिमम ब्रेविस बीच में आ गया. Abductor hallucis brevis, abductor digitum minimi brevis, बीच में आ गया flexor digitum brevis. Put an abductor, abductor बीच में flexor. अब थर्ड लेयर में टेक फ्लेक्सस ऑन बोथ द साइड्स, दोनों साइड्स पे फ्लेक्सर ले लो आप. हाँ, टेक फ्लेक्सस ऑन बोथ द साइड्स. पुट अ फ्लेक्सर हियर, फ्लेक्सर hallucis brevis. Put a flexor here, flexor digiti minimi brevis, and put an adductor here, adductor hallucis. Simple. फर्स्ट लेयर में एबडक्टर एबडक्टर बीच में फ्लेक्सर, थर्ड लेयर में फ्लेक्सर फ्लेक्सर बीच में एडक्टर. इससे इजी और कुछ नहीं है. आई एम मेकिंग इट वेरी वेरी इजी फॉर यू. ओके, सेकेंड लेयर, सेकेंड एंड फोर्थ लेयर में मसल्स कम्स फ्रॉम द लेग. ये लेग से आते हैं मसल्स. विच आर द मसल्स विच कम्स फ्रॉम द लेग? यस, फ्लेक्सर hallucis longus, फ्लेक्सर digitorum longus, ये लेग से आते हैं. देन यू हैव lumbricals and the flexor digitorum accessorius. So ये दो legs से आगे, flexor hallucis longus, flexor digitorum longus. These are there in the foot, lumbricals and flexor digitorum accessorius. Last layer of the sole contains tibialis posterior, peroneus longus, and intraossei. बस, that's it. ये है layers of the sole. ठीक है बच्चों, आर यू एबल टू फॉलो दिस? दीज आर द लेयर्स ऑफ सोल. बस ये याद रखना है आपको. जस्ट रिमेंबर दिस मच. सो एवरीथिंग वी आर कवरिंग. हाँ, सब कुछ कवर कर रहे हैं अपन. डन. ठीक है बच्चों, दिस इज वेरी इजी टू अंडरस्टैंड. बहुत इजी है. मैंने कैसे बोला आपको? एबडक्टर एबडक्टर बीच में फ्लेक्सर, थर्ड लेयर में फ्लेक्सर फ्लेक्सर बीच में एडक्टर. अब सेकेंड एंड फोर्थ लेयर मिक्स होता है. मसल लेग से भी आते हैं एंड सोल में भी होते हैं. फाइन, आई प्रोसीड. ठीक है, आई प्रोसीड. फाइन, बस ये याद रखना. दिस इज इजी, बहुत इजी था ये. अरे बच्चे, कैसे याद रखने का? सी, फर्स्ट एंड थर्ड लेयर है ना, छोटे छोटे मसल्स हैं. छोटे मसल्स मतलब इंट्रिंसिक मसल्स. छोटे मसल्स मतलब दे विल एंड विद ब्रेविस. छोटे छोटे मसल्स दे विल एंड विद ब्रेविस. ठीक है ना? सो कैसे याद रखोगे? इधर एक एबडक्टर डाल दो. सी, हाउ डू यू रिमेंबर? इधर एक एबडक्टर डाल दो, इधर एक एबडक्टर डाल दो, बीच में एक फ्लेक्सर डाल दो. हाँ, तो छोटा मसल है. ये क्या है? ग्रेड टो है. सो एबडक्टर hallucis brevis. ये एबडक्टर लिटिल फिंगर है. सो एबडक्टर digiti minimi brevis. बीच में एक फ्लेक्सर डाल दो, फ्लेक्सर digitorum brevis. ठीक है. अब थर्ड लेयर में टेक फ्लेक्सस ऑन बोथ द साइड्स. छोटे छोटे मसल्स है, इंट्रिंसिक मसल्स है. सो यह है फ्लेक्सर hallucis brevis. यह है फ्लेक्सर digiti minimi brevis. एंड बीच में एक एडक्टर डाल दो, एडक्टर hallucis. And then this two will come from leg, this two will come from leg, and ये सोल में होते हैं. बस. ठीक है बच्चे, that's it. Fine. You tell me now, what is this? This is foot drop. Foot drop. And foot drop is due to injury to the common peroneal nerve or the deep peroneal nerve. So your first answer is going to be the common peroneal nerve. Always, always. अगर common peroneal nerve नहीं है तो then take it as deep peroneal nerve. अरे बच्चे, सेकेंड लेयर में फ्लेक्सस है. सेकेंड लेयर में फ्लेक्सस लेग से आते, वो लेग पोस्टीरियर कंपार्टमेंट ऑफ लेग से आते बच्चे. फ्लेक्सर hallucis longus, फ्लेक्सर digitum longus, ये लेग से आते. ठीक है. That's foot drop. This is nothing here. That's foot drop. चलो, come answer this. कुछ important MCQ है. Strongest ligament of hip joint. Come on students, come on. Strongest ligament of hip joint. This is extremely important. अगर thigh को extend करते हो, if you are extending the thigh, you can't take the thigh beyond a particular extent. Which is the ligament? ये कौन सा ligament है? Which is preventing hyperextension at the hip joint. Come on. This you should know. This you should know. Strongest ligament of the hip joint. It prevents hyperextension. इसका नाम है iliofemoral ligament. Iliofemoral ligament or the ligament of Bigelow. Ligament of Bigelow. Strongest ligament of hip joint is the iliofemoral ligament or the ligament of Bigelow. Ligament of Bigelow. याद रखिए. Deltoid ligament. Deltoid ligament is present on the medial aspect of the ankle joint. Medial aspect of ankle joint. Medial aspect of the ankle joint. Spring ligament. Spring ligament का दूसरा नाम है plantar talocalcaneonavicular ligament. Talocalcaneonavicular ligament. Talocalcaneonavicular ligament. हाँ ये याद रखना. Spring ligament supports the medial longitudinal arch. ये medial longitudinal arch को support करता है. बस ये sling is not so important. Just remember this three. Sling is a support. Sling for the medial longitudinal arch. Medial longitudinal arch and lateral longitudinal arch. Sling for the medial longitudinal arch is tibialis anterior, tibialis posterior, and ये होगा peroneus longus, peroneus brevis. Medial longitudinal arch of the foot पता है ना आपको? Sling ऊपर से आता है, ऐसे खींचता है. It supports it up. So sling for the medial longitudinal arch is tibialis anterior, tibialis posterior. For the lateral longitudinal arch, the sling is peroneus longus and peroneus brevis. बस इतना याद रखिए. So that's about the lower limb. I hope this is clear. Chalo, we'll come to the next. Huh? Fine है बच्चों. Is this clear? We'll proceed. Chalo, I'll just draw a slide for you. एक slide draw करता हूँ. If you can answer this. See, ये है internal jugular. This is the subclavian vein on the right side. That's the internal jugular. Subclavian on the left side. ये बन गया right. ये बन गया राइट ब्रेकियोसेफालिक, ये बन गया लेफ्ट ब्रेकियोसेफालिक, ये बन गया अपना एसवीसी. ये कौन है? इंटरनल जुगुलर वेन. ये है सबक्लेवियन वेन. दिस इज द ब्रेकियोसेफालिक वेन. राइट साइड, लेफ्ट साइड, ये बन गया एसवीसी. एंड व्हाट इज दिस? कैन एनीवन टेल मी व्हाट इज दिस वेन? ये वेन कौन है? एनीवन? व्हाट इज दिस वेन? Thorax है, thorax. Yes, बच्चों बोलो. ये कौन सी vein है? Which is the vein which arches over the hilum of the right lung? Which is the vein which drains into the SVC? Azygous. That's a azygous vein. तो ये internal jugular, ये subclavian, ये brachiocephalic, ये right, ये left, that's a SVC, that's a azygous vein. ठीक है? Now, these are the posterior intercostal veins. So the first right posterior intercostal vein. So the first right posterior intercostal vein drains into right brachiocephalic vein. इस पे बहुत MCQs आते हैं. The first left posterior intercostal vein, that's the first left posterior intercostal vein, drains into left brachiocephalic. Second, third, and fourth right posterior intercostal vein joins to form. This is known as the right superior intercostal vein. This drains into azygous. So ये right superior intercostal vein क्या होती है? So right superior intercostal vein is formed by the joining of the right, second, third, and fourth posterior intercostal vein. Drains into azygous. Second, third, and fourth on the left side joins to form, what is that? The left superior intercostal vein. That drains into left brachiocephalic. All the veins on the right side now drains into azygous vein. On the left side, 5, 6, 7, 8 joins to form a vein here. इसका नाम है accessory hemiazygous. Accessory hemiazygous vein. 5, 6, 7, 8, 9, 10, 11, 12. joins to form a vein here. इसका नाम है hemiazygous vein. hemiazygous vein. So 5, 6, 7, 8 लेफ्ट साइड पे बनती है एक्सेसरी हेमियाजाइगस, 9, 10, 11, 12 बनती है हेमिएजाइगस. दिस ड्रेन्स इनटू एजाइगस वेन. तो एमसीक्यू किस पे आता है बच्चों? एमसीक्यू आता है ऑन दिस. इस पे एमसीक्यू आता है. द राइट सुपीरियर इंटरकॉस्टल वेन ड्रेन्स इनटू व्हाट? आंसर इज एजाइगस. लेफ्ट सुपीरियर इंटरकॉस्टल वेन ड्रेन्स इनटू द लेफ्ट ब्रेकियोसेफेलिक वेन. इस पे एमसीक्यू आता है. ठीक है. समझ में आया ना ये? हाँ, इस how it is formed. This is what is asked in the exams. Fine. So left superior intercostal vein drains into left brachiocephalic vein. This drains into left brachiocephalic vein. Right superior intercostal vein drains into azygous vein. Azygous vein. What is intercostobrachial nerve? Anyone? Intercostobrachial nerve is the lateral cutaneous branch of the second intercostal nerve. जो सेकेंड इंटरकॉस्टल नर्व है ना, उसकी ब्रांच है. द ब्रांच इज नोन एज लैटरल क्यूटेनियस ब्रांच. द लैटरल क्यूटेनियस ब्रांच ऑफ द सेकेंड इंटरकॉस्टल नर्व जॉइंस विद द मीडियल क्यूटेनियस नर्व आर्म. दिस इज द इंटरकॉस्टोब्रेकियल नर्व. अरे बच्चे, आईवीसी एजाइगस में कैसे ड्रेन होगा? नहीं, आईवीसी डजंट ड्रेन इनटू एजाइगस. हाय स्नेहर, वेरी गुड बच्चे. IVC is a different vein. IVC drains into the right atrium. बच्चे, IVC drains into the right atrium. Azygous vein drains into SVC. Azygous vein drains into SVC. Fine. Is this clear? So can anyone tell me what is the extent of lung and extent of pleura in the mid-axillary, mid-clavicular line, mid-axillary line, mid-scapular line? चलो बोलो. Mid-clavicular, mid-axillary, mid-scapular line. What is the extent of lung and the pleura? ये पूछते हैं. Mid-clavicular, mid-axillary, mid-scapular line. Extent of lung बताओ. Extent of lung 6th rib, 8th rib, 10th rib. And pleura 8th rib, 10th rib, 12th rib. 8, 10, 12. ठीक है ना? Extent of lung in the mid clavicular, mid axillary, mid scapular line 6, 8, 10, and this is 8, 10, 12. हाँ, very good. Tajammul, very good, excellent. ठीक है. So extent of lung 6th rib, 8th rib, 10th rib, and lung and pleura 2 ribs नीचे होता है 8, 10, 12. बस ये याद रखना. Clear है बच्चों? Okay, that was a slide. Okay, great, great. Can anyone tell me transverse sinus and oblique sinus? Oblique sinus कहाँ पे होता है? Where does the oblique sinus lie? Oblique sinus lies behind what? Oblique sinus lies behind the left atrium. Left atrium. Left atrium में what opens in the left atrium are the pulmonary veins. The pulmonary veins opens in the left atrium. The left atrium has to distend. उसको बड़ा होना है. The left atrium has to distend. तो left atrium के पीछे एक space होता है. Name is oblique sinus. So oblique sinus of the pericardium lies behind what? Left atrium. याद रखना. And transverse sinus lies between ascending aorta and pulmonary trunk. Ascending aorta and pulmonary trunk and SVC. ये दोनों साथ में होता है. Ascending aorta and pulmonary trunk, that's anterior and to the left, and pulmonary trunk is, and SVC is to the right, posterior and to the right. So ascending aorta and pulmonary trunk is anterior and left. The SVC is posterior and right. उनके बीच में एक स्पेस होता है. That space is what we call as the transverse sinus. Transverse sinus. Just remember this. Can anyone tell me what is the right and the left coronary artery supply? हाँ, या फिर यहीं पर बोल दो, what is the right coronary artery supply? The right coronary artery supplies the right atrium, right ventricle, SA node, AV node, left bundle of his posterior 1/3 of the interventricular septum and the apex of the heart. Apex of the heart, ये याद रखना, बहुत इंपॉर्टेंट है. एरिया ऑफ डिस्ट्रीब्यूशन ऑफ द राइट कोरोनरी, एरिया ऑफ डिस्ट्रीब्यूशन ऑफ द लेफ्ट कोरोनरी. ओके, सो राइट कोरोनरी क्या सप्लाई करता है? राइट एट्रियम, राइट वेंट्रिकल, एसए नोड. बच्चे बहुत बार पूछा गया है, लॉट ऑफ टाइम इट हैज बीन आस्क्ड, एसए नोड इज सप्लाइड बाय व्हाट? योर आंसर इज राइट कोरोनरी आर्टरी. सो द राइट कोरोनरी आर्टरी सप्लाइज द right atrium, right ventricle, SA node, AV node, left bundle of his, the posterior 1/3 of the interventricular septum and the apex of the heart. The left coronary. The left coronary supplies what? The left coronary supplies the left atrium, left ventricle, left and right bundle of his, dono, left and right bundle of his anterior 2/3 of interventricular septum and the apex of the heart. So left coronary क्या supply करती है? Left atrium, left ventricle, left and right bundle branch or the bundle of his. It supplies the anterior 2/3 of the interventricular septum and the apex of the heart. बस बच्चों इतना याद रखो. This is always asked in the exams. हमेशा पूछते हैं ये exams में. Right coronary का area of distribution, left coronary का area of distribution. ठीक है? Yes, Tajammul, fine. स्नेहर, अनुभव, yes. बाकी बच्चों आंसर करो. Keep on answering, keep on answering. समझ में आ रहा है ना? You're getting content. बहुत important है ये सब. चलो, coming to the next. Bronchopulmonary segments. Bronchopulmonary segments, इसमें दो MCQs आता है. I'll just tell you the MCQs. एक चीज बोलना. Who runs between the bronchopulmonary segment? What is this structure? What is this structure? ये कौन होता है? In between the bronchopulmonary segments. ऐसे. ये कौन है? If I have two, क्या लिखा है? If I have to remove this segment, if I have to remove one bronchopulmonary segment, what is this structure who lies between the bronchopulmonary segments? अगर मैं ये segment को अगर मैं इसको trace करता हूँ, I'll be able to define one segment, ये दूसरा segment, ये तीसरा segment, चौथा segment, पांचवा. What is this structure which lies within the bronchopulmonary segments? Come on, answer this. This you should know. This you should know. Very important. These are the pulmonary veins. Pulmonary veins मतलब bronchopulmonary segments को define कैसे करें? How do you define the bronchopulmonary segments? Because of the pulmonary veins. MCQ है pulmonary veins are. Your answer intersegmental. Pulmonary veins are intersegmental. Just याद रखना. Pulmonary veins are intersegmental. Fine. This is what is asked. Okay. So left. Right. So I'll just tell you one MCQ. यहाँ पे एक MCQ आता है which is very commonly asked. Foreign body entering the nose. Foreign body entering the nose goes to which bronchopulmonary segment? Foreign body जब नाक में जाता है, foreign body when it enters the nose, which bronchopulmonary segment does it go? And दूसरा है aspiration pneumonia. Aspiration pneumonia is common in. बोलो, ये दो MCQs है. Can anyone answer this? There are two MCQs here. Come on, बच्चों, answer this. Come on students, come on, answer this. हाँ, करीना नहीं बच्चे. अगर कोई भी बच्चा फॉरेन बॉडी डालता ना, if a foreign body enters the nose, it directly goes to, your answer is posterior basal segment of right lung. Foreign body, if it enters the nose, it directly goes to the posterior basal segment of the right lung. Posterior basal segment of right lung. ये MCQ है. This is a very important MCQ. हाँ, foreign body जब nose में जाती है तो where does it go? In the posterior basal segment of the right lung. ये याद रखना. And दूसरा MCQ है aspiration pneumonia is common in apical segment or superior segment of lower lobe. These are always asked. ये हमेशा पूछते हैं. Very good. So जब foreign body nose में जाती है, it enters into the posterior basal segment of the right lung. And aspiration pneumonia. Aspiration pneumonia मतलब a person is lying down, या फिर एक बच्चा है, the child is being fed, the child vomits and the child aspirates the vomiters. So what does the child develop? Aspiration pneumonia. अगर aspiration pneumonia होता है तो which segment does it enter? It enters into the apical segment of the lower lobe. Apical segment of lower lobe. Fine. Just remember that. These are the two MCQs here which are very important. Okay, that's the same. Now we come to this. Can anyone tell me ये कैसे form होता है? ये आपको पता है? Do you know this? How this? यहाँ पे एक aortic arch arteries होती हैं. हाँ, do you know this aortic arch arteries? Third arch, fourth arch, sixth arch arteries. हाँ, तो how are these arteries formed? If anyone can answer this, let me see how much you know. Arch of the aorta कैसे derive होता है? या इसमें क्या पूछते हैं ना? Subclavian artery, left, right, common carotids. ये कैसे form होता है? Does anyone know this? You can answer this. How does the subclavian artery formed? Yes. So the left subclavian artery is derived from the left 7th cervical intersegmental artery. Left 7th cervical intersegmental artery. The right subclavian artery is derived from the right 4th arch artery and the right 7th cervical intersegmental artery. ये आपको पता है क्या? पता है ना? हाँ पंकज, हाँ, वेरी गुड, एक्सीलेंट बच्चे, एक्सीलेंट. पंकज, वेरी गुड. सो ये जो सबक्लेवियन आर्टरी होती है डिफरेंट है लेफ्ट साइड राइट साइड पे, बस ये याद रखना. द लेफ्ट सबक्लेवियन आर्टरी इज डिराइव्ड ओनली फ्रॉम 7th cervical intersegmental artery. The right subclavian artery is derived from the right 4th arch artery and the right 7th cervical intersegmental artery. Just remember this. Matlab, this is the 4th arch artery, that's the 7th cervical intersegmental artery. So look, the left subclavian artery is derived only from this left 7th segmental intersegmental artery. The right is derived from the 4th arch artery and the 7th cervical intersegmental. दोनों से बनता है ये. Okay. How's the arch of aorta formed? I'm just telling you this directly बोल रहा हूँ. Arch of aorta is derived from the left horn of aortic sac, and the left 4th arch artery. Left horn of aortic sac and the left 4th arch artery. How's the pulmonary artery derived from? Pulmonary artery is derived from the 6th arch artery. Common carotids are derived from the 3rd arch artery. Ductus arteriosus is derived from the 6th arch artery. बस इतना याद रखिए. बस इतना ही याद रखना. What I have told you. Arch of the aorta is derived from the left horn of the aortic sac and the left 4th arch artery. But remember this. and how the subclavian arteries are formed. Now I can't explain you everything right now. So what are important from exam point of view मैं बोल रहा हूँ. Aortic arch arteries. Sixth arch artery. Yes, very good Pankaj, very good. Good. ये है डेवलपमेंट ऑफ एओटिक आर्च आर्टरीज, ये याद रखना. ओके चलो बच्चों, सो कमिंग टू अ वेरी वेरी इंपॉर्टेंट MCQ here. Answer this. Skin over the angle of mandible is supplied by. चलो आंसर बोल सकते हो. Skin over the angle of mandible is supplied by. बहुत इंपॉर्टेंट है, ये PYQ है, बहुत बार पूछा गया है. अनुभव कहाँ गए? यस द रेस्ट ऑफ यू बच्चों कहाँ गए हो सब? कम ऑन, बी एक्टिव, बी एक्टिव. स्मूथ स्पेशलिस्ट कहाँ गया? सैयद सैयद सैयद, अक्षय, who else is there? स्नेहर, स्नेहा, स्नेहर, अनुभव is there. चलो बच्चों बोलो. Skin over the angle of mandible is supplied by, yes, the greater auricular nerve. Remember this. This is the greater auricular nerve. The great auricular nerve is a branch of cervical plexus. The entire face is supplied by whom? Trigeminal nerve. ये पूरा face sensory nerve supplies the trigeminal nerve, except the skin over the angle of mandible. This is supplied by greater auricular nerve, and this is a branch of cervical plexus. Inferior mandibular nerve नहीं है अमित, नहीं नहीं बच्चे, inferior mandibular nerve नहीं है. Inferior alveolar बोल रहा हूँ, नहीं. Skin over the angle is, skin over the chin is supplied by inferior alveolar nerve, chin chin, but skin over the angle is supplied by greater auricular nerve. Trigeminal नहीं है बच्चे, trigeminal नहीं है. The entire face को trigeminal nerve supply करता है except angle of mandible, इसलिए तो वो MCQ है. That is why it is MCQ. It is supplied by greater auricular nerve. याद रखें. What is the answer? Cervical is not supply. Okay, does not supply. बोल सकते हैं answer cervical is does not supply what? Answer cervical is supplies the sternohyoid, sternothyroid, omohyoid. So what it does not supply? Which strap muscle it does not supply? Okay, answer cervical is supplies sternohyoid, sternothyroid, omohyoid, omohyoid. What it does not supply? Except thyrohyoid. मतलब which strap muscle is not supplied by ansa thyrohyoid. हाँ फेस के लिए ठीक है बच्चे, फेस के लिए ठीक है. पंकज, thyroid is supplied by whom? Thyroid को कौन सप्लाई करता है? C1, C1, fibers of C1. मतलब जितने भी स्ट्रैप मसल्स हैं, all the strap muscles are supplied by ansa cervicalis except thyrohyoid. And thyroid को कौन सप्लाई करता है? C1, C1. Damage to the spinal accessory nerve in the posterior triangle of the neck leads to, हाँ ये बोल सकता हूँ, paralysis of trapezius. Paralysis of trapezius. Why? ये spinal accessory nerve first supplies the sternocleidomastoid. वो पहले sternocleidomastoid को supply करती है, then it comes in the posterior triangle of the neck, lies on the levator scapulae and goes to supply the trapezius. फिर वो trapezius को supply करती है. So if we cut the nerve in the posterior triangle of the neck, this is very important. अगर spinal accessory nerve posterior triangle में damage होती है, sternocleidomastoid is intact. Sternocleidomastoid is intact. Who is damaged? Trapezius. ये clear है? Trapezius is damaged. Fine है बच्चे, ये याद रखना. This is very important. Relations in the lateral wall of the cavernous sinus. बोल सकते हो? Lateral wall of cavernous sinus के relations. Can anyone tell me this? That's a cavernous sinus. Okay, who's related to the medial wall of the cavernous sinus? That's a pituitary gland. And this is the sphenoidal air sinus. In the lateral wall, lateral wall of cavernous sinus, third, fourth ophthalmic division and the maxillary division of trigeminal nerve. That's in the floor is the sixth nerve, internal carotid artery. ऊपर है optic chiasma, optic chiasma. Yes, fine. Okay. So in the lateral wall of cavernous sinus कौन है? Third nerve, fourth nerve, ophthalmic and maxillary nerve. Who's not related to the cavernous sinus? Mandibular nerve is not related to the cavernous sinus. Floor में कौन है? Floor में the sixth nerve and the internal carotid artery. ये floor में है. Medial wall में कौन है? Medial wall में this is the pituitary gland and that's the sphenoidal air sinus. Sphenoidal air sinus. Fine. These are the relations of cavernous sinus. So structures in the lateral wall of cavernous sinus, ये याद रखना बहुत important है. This was always asked. Fine students, come on, let us proceed. Okay, ये बोल सकते हो what is this? ये है ना, this is the PYQ. Can anyone tell me what is this structure? ये कौन है? ये कौन है? हाँ, A and B. Come on, can you answer this? Yes, Anubhav? Come on, answer this. What is this fascia? This is the investing layer. That's the investing layer of the deep cervical fascia. This is the prevertebral fascia. That's a prevertebral fascia, and this is the pretracheal. That's a pretracheal fascia. What is A and what is B? Internal jugular vein नहीं है. मैं internal jugular vein क्यों पूछूंगा? I'm not asking that. Internal jugular vein. What is that? Nerve. Nerve है. वो carotid sheath है. Carotid sheath के अंदर who's that? A. This was a PYQ. ये PYQ था. Carotid sheath के अंदर. This is the carotid sheath, no बच्चे? Carotid sheath में internal carotid artery, internal jugular vein. This is the internal carotid artery. That's the internal jugular vein. What's this? Nerve. That's a vagus nerve. That's a vagus. Yes. And what is this B? Who's behind the carotid sheath? Carotid sheath के पीछे कौन है? ये sympathetic chain. बच्चे, these are all PYQs. These are all visuals. हाँ, visuals है. ये सब याद रखना. These are all visuals. हाँ, that's vagus, and that is the sympathetic chain. Sympathetic chain. ये कौन है बोल सकते हो? What is this nerve? ये trachea है, ये esophagus है. That's the recurrent laryngeal nerve. वो recurrent laryngeal nerve है. Between the trachea and the esophagus, तीन fascias है. मैंने बोल दिया investing prevertebral, and that's a pretracheal fascia. Investing pretracheal and prevertebral fascia. Fine. Okay, can anyone tell me the branches of external carotid artery, बच्चों? Branches of external carotid artery. Quick anterior branches. Anterior branches of external carotid artery. That's superior thyroid, lingual, and facial. Superior thyroid, lingual, and facial. Posterior branches. Posterior branches is posterior auricular. Posterior auricular and occipital. Posterior auricular and occipital. Posterior auricular and occipital. Medial branch. Medial branch is ascending pharyngeal. Ascending pharyngeal. And terminal branches. Terminal branches is superficial temporal artery and maxillary. Superficial temporal and maxillary. ये याद रखना. This is very important. Nasal नहीं है. अनुभव, nasal nasal नहीं है. So anterior branches, the first anterior branch is superior thyroid, फिर lingual, फिर facial. Posterior branches is posterior auricular and occipital. Medial branch एक ही है, that's the ascending pharyngeal. And terminal branches are superficial temporal and maxillary. Superficial temporal and maxillary. ठीक है. So just remember this branches of external carotid always asked. चलो quick. One word answer. चलो nerve supply of parotid. Come on, take this students. Very important for you. बहुत important है आपके लिए. Nerve supply of parotid gland. Yes. Which is the nerve which supplies the parotid? Can anyone answer this? Secretomotor fibers to parotid. कौन supply करता है? बोलो जल्दी. Come on students, come on, you can answer this. Take this. Auriculotemporal nerve नहीं है बच्चे. Auriculotemporal nerve नहीं है. Auriculotemporal nerve बस fibers को carry करती है. It just carries the fibers. Which is the cranial nerve which supplies the parotid gland. That's the glossopharyngeal nerve. That's a glossopharyngeal nerve. The glossopharyngeal nerve supplies the parotid gland. And which is the nerve which supplies the submandibular gland? That's a facial nerve. Facial nerve supplies the submandibular, all the glands in the head and neck except parotid, which is supplied by glossopharyngeal nerve. Auriculotemporal nerve nahi. Auriculotemporal nerve just carries the fibers. The main nerve which supplies the parotid gland is glossopharyngeal. ठीक है अनुभव क्लियर है? Okay. Nerve supply of the larynx. Motor nerve supply of the larynx बोल सकते हो. Motor nerve supply of the larynx is recurrent laryngeal nerve except cricothyroid. Cricothyroid का nerve supply बोलिए. Cricothyroid का nerve supply is external laryngeal nerve. So all the muscles of the larynx are supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by. हाँ बच्चे, फ्रेज सिंड्रोम में ऑरिकुलोटेम्पोरल नर्व एंड ग्रेटर ऑरिकुलर नर्व का मिक्सिंग होता है बराबर. बट अगर एमसीक्यू आता है नर्व सप्लाई ऑफ पैरोटिड ग्लैंड, आप लिखोगे ग्लॉसोफैरिंजियल. 100% ग्लॉसोफैरिंजियल ऑलवेज. Motor nerve supply of larynx, all the muscles of larynx are supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by external laryngeal nerve. What is the action of cricothyroid? It tenses the vocal cords. So cricothyroid क्या करता है? Tenses the vocal cords. Who's an abductor of the vocal cords? Come on students, take this MCQ. Who's the abductor of vocal cords? Answer this. Who's the abductor of vocal cord? Cricothyroid is a tensor of vocal cords. Who's an abductor of vocal cords? अगर ये पैरालाइज हो गया तो person will die. Anyone? Abductor of vocal cord is posterior cricoarytenoid. Posterior cricoarytenoid. बच्चे ये पता है ना आपको? Do you know this? हाँ? Yes? अनुभव? Tensor of vocal cords? ये याद रखना, this is very important. Tensor of vocal cords is cricothyroid. Abductor of vocal cords is posterior cricoarytenoid. Posterior cricoarytenoid. ये याद रखना. Okay. Find sensory nerve supply of the larynx. Sensory nerve supply of the larynx above the vocal folds, above the vocal cords, below the vocal cords. Above the vocal cords is internal laryngeal nerve. Below the vocal cords is recurrent laryngeal nerve. So nerve supply of larynx समझ में आया? Motor nerve supply. All the muscles of the larynx are supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by external laryngeal nerve. The sensory nerve supply of the larynx above the vocal folds is internal laryngeal nerve. Below the vocal folds is recurrent laryngeal nerve. Fine. Sensory nerve supply of the tongue. Yes, tongue का nerve supply बता सकते हो. Tongue. Anterior 2/3, posterior 1/3, and the posterior most part. Anterior 2/3, posterior 1/3, posterior most part. General sensations, special sensations. General sensations, special sensations. Anterior 2/3 general sensations कौन है? Lingual. स्पेशल सेंसेशंस कौन है? कॉर्डा टिम्पैनी. Chorda tympani. That's a branch of facial. Posterior one-third both general and special sensation is glossopharyngeal nerve, and posterior most part is vagus. Vagus की branch है internal laryngeal nerve. Internal laryngeal nerve. So just remember general sensations of the tongue, anterior two-thirds. You know this? Yes. Very good. Anterior two-thirds lingual, special sensations chorda tympani. Posterior one-thirds glossopharyngeal. Posterior most part is vagus. All the muscles of the tongue are supplied by hypoglossal nerve except palatoglossus, which is supplied by pharyngeal plexus. All the muscles of the tongue are supplied by hypoglossal nerve except palatoglossus, which is supplied by pharyngeal plexus. Pharyngeal plexus. Ye yaad rakhna. Okay, so that's it. That's about the. Okay. What is this muscle? चलो आंसर दिस. ये कौन सा मसल है? नंबर 1. ये कौन सा मसल है? नंबर 2. ये कौन है? नंबर 3. It's written here and number 4 is written here. 3 and 4 लिखे हुए हैं. Who's 1 and 2? Any guesses, students? What is number 1 and what is number 2? Come on, come on, come on. हाँ, very good, अनुभव. Very good, बहुत बढ़िया, बहुत बढ़िया. Baki students also answer. The rest of you can also answer. Who's number 1? Who's number 2? Anyone? What's number 1? Temporalis. Number 2 कौन है? Masseter. Very good. Number 1 is temporalis. 2 masseter है. 3 medial and lateral pterygoids है. Now all these muscles of mastication are formed in the first pharyngeal arch. इसकी nerve कौन है? Who's the nerve of the first arch? Mandibular nerve. So all the muscles of mastication are supplied by mandibular nerve. जितने भी muscles of mastication है, who supplies it? Mandibular nerve. Mandibular nerve. Fine. So this is temporalis. That's masseter. That's lateral pterygoid. That's medial pterygoid. That's supplied by mandibular nerve. Fine. Okay. Maxillary नहीं है रे बच्चे. Mandibular है. Mandibular nerve. All the muscles of mastication are supplied by mandibular nerve. Hi Leelavati. Hello. अनुभव maxillary नहीं है, it's mandibular nerve. चलो students, can anyone tell me this now? चलो foramens बोल दो. What passes through the superior orbital fissure? Anyone? What passes through the superior orbital fissure? वैसे superior orbital fissure के 3 compartments होते हैं. There are 3 compartments of the superior orbital fissure. This is a lateral compartment, that's an intermediate compartment, and that's a medial compartment. Lateral compartment of superior orbital fissure से कौन जाता है? Can anyone tell me? Lateral compartment of superior orbital fissure से कौन जाता है? This is lacrimal, this is frontal, this is trochlear. Intermediate compartment से जाता है oculomotor, oculomotor. This is nasociliary, this is abducens. This is the inferior ophthalmic vein. So what passes through the lateral compartment of the superior orbital fissure? Hi. Come on, students. Just concentrate here. What passes through the lateral compartment of superior orbital fissure? The lacrimal, the frontal, and the trochlear nerves. Who passes through the intermediate compartment? The oculomotor, nasociliary, and abducens nerves. And medial compartment से जाती है inferior ophthalmic vein. Very good, Lakshya. Very good. बढ़िया. ठीक है, चलो. What passes to the optic canal? Come on बच्चों, ये foramens बहुत इंपॉर्टेंट है. Optic canal से क्या जाता है? Anyone? Optic canal से जाएगा optic nerve, हाँ, optic nerve and ophthalmic artery. Optic nerve and ophthalmic artery. हाँ, ये याद रखना, ये बहुत इंपॉर्टेंट है foramens. Foramen rotundum. Come on students, take this MCQ. Foramen rotundum, structure passing. Foramen rotundum, structure passing. Maxillary nerve. Maxillary nerve. Fine. Foramen ovale. Foramen ovale. ये याद है ना? M-A-L-E. M कौन है? Mandibular nerve. A कौन है? Axillary meningeal artery. L कौन है? Lesser petrosal nerve. And E is emissary vein. Emissary vein. M-A-L-E. What passes to foramen spinosum? Foramen spinosum से जाता है middle meningeal artery and nervous spinosus. Middle meningeal artery and nervous spinosus. Internal acoustic meatus, 7th nerve, 8th nerve, and labyrinthine artery. 7th nerve, 8th nerve, and labyrinthine artery. Very good. What passes to the anterior condylar canal? Anterior condylar canal is hypoglossal canal. Anterior condylar canal is hypoglossal canal. What passes to this is hypoglossal nerve. Hypoglossal nerve. कुछ doubts है? Any doubts? Fine. So ये सब याद रखना, ये सब important है. All these MCQs are very important. Okay. So ये सब foramens है. So these are the foramens that I've just told you. Can anyone tell me what is this nerve? Yeah, no, this is a very important visual है ये visual slide. What is this number 1 and what is this number 2? ये nerves identify करिए. And what is this artery number 3? Anyone? मतलब we have removed this, mandible को निकाल दिया, ramus को निकाल दिया. What is this 1 and 2? This you should know. This you should know. Who's number 1? Who's number 2? Bolo, bolo, bolo. हाँ, any guesses? Guess करो ना. Number 1 वही nerve है जो anterior 2/3 of tongue को supply करती है, general sensation supply करती है. So number 1 is the lingual nerve. Lingual nerve. Number 2 enters the mandible, यहाँ से बाहर आती है. That's the inferior alveolar nerve. Inferior alveolar nerve. Number 3 कौन है? Maxillary artery. Number 3 is the maxillary artery. Very good. Laksha, very good. Okay, what is this? That's a larynx. ये larynx है. ये ऊपर कौन है, नीचे कौन है, बोल सकते हो? Sorry, what is this number 1 and what is this number 2? 1 is the vestibular fold. Vestibular fold. And दो कौन है? Vocal fold. दो vocal fold है. And ये 3 कौन है? Who's 3? 3 is the ventricle. Ventricle or the sinus of larynx. Ventricle or the sinus of larynx. 3 is transverse facial नहीं है वो बच्चे, transverse facial नहीं है. Transverse facial is a branch of superficial temporal. हाँ लक्ष्य, transverse facial is a branch of superficial temporal artery. ये ना, see, this is the external carotid artery, this is the maxillary artery, and ये जो है ना, ये that's a superficial temporal. That's a superficial temporal artery. अब ये जो superficial temporal artery है ना, it will go up like this. ये ऊपर जाती है, ये एक branch देती है, ये है transverse facial. That is transverse facial. Okay, ये याद रखिए. Just remember this. Hello students. Hello students. Can anyone tell me what passes to the jugular foramen? जुगुलर फोरामेन से क्या जाता है? जुगुलर फोरामेन के 3 कंपार्टमेंट्स होते हैं, बोल सकते हो? जुगुलर फोरामेन के 3 कंपार्टमेंट्स होते हैं, एंटीरियर, मिडिल एंड पोस्टीरियर. व्हाट पासेस टू द एंटीरियर कंपार्टमेंट इज द इंफीरियर पेट्रोसल साइनस. इंफीरियर पेट्रोसल साइनस. What passes to the posterior compartment is the sigmoid sinus. Sigmoid sinus. And what passes to the middle compartment? Middle compartment से क्या जाता है? 9th, 10th, 11th cranial nerves. That's a jugular foramen. That's a jugular foramen. Jugular foramen, anterior compartment, what passes is inferior petrosal sinus. I want some water. Anterior compartment, what passes is inferior. Hello? Hello, hello? Anterior compartment, what passes is the inferior petrosal sinus. Middle compartment, what passes is the 9th, 10th, 11th cranial nerves. and posterior compartment what passes is the sigmoid sinus. Okay, so sigmoid sinus will continue as an internal jugular vein. Internal jugular vein. Fine. Clear to all of you? That's the jugular foramen. Jugular foramen. याद रखना, jugular foramen is very important. ठीक है? Okay. Come on. Now answer this. First pharyngeal arch. Muscles बोल सकते हो. Muscles formed from the first pharyngeal arch. Any guesses? Muscles derived from the first pharyngeal arch. One are the muscles of mastication. Muscles of mastication. Muscles of mastication कौन है? Temporalis है, masseter है, medial and lateral pterygoids. Temporalis, masseter, the medial and the lateral pterygoids. Okay, muscles of mastication. फिर आता है tensor palati, tensor palati and tympani. Tensor palati and tensor tympani. फिर आता है mylohyoid and anterior belly of digastric. Anterior belly of digastric. इसमें MCQs बहुत आते हैं, बहुत MCQs आते हैं. So just remember all the muscles of mastication, वो 4 muscles of mastication है. फिर हाँ, lateral, medial, pterygoid, all those things. Swajit, hi Swajit. हाँ. So muscles of mastication, tensor palati, tensor tympani, the mylohyoid and the anterior belly of digastric. ये जितने भी muscles हैं ये first pharyngeal arch में form होते हैं. Which is the nerve of the first pharyngeal arch? Mandibular. Mandibular nerve is the nerve of the first pharyngeal arch. Which is the nerve of the second arch? Facial nerve. Facial nerve. So which are the muscles formed in the second pharyngeal arch? Muscles in the second pharyngeal arch, muscles of facial expressions. Facial expression. फिर आता है stapedius. फिर आता है posterior belly of digastric. फिर आता है stylohyoid. Stylohyoid. Posterior belly of digastric, stylohyoid. Okay. Okay, just give me 2 minutes or 2 minutes. Take a break of 2-3 minutes and we'll meet back. Huh? Take a break of 2-3 minutes and we'll be back. 2-3 minutes. Okay, hello. Fine. Okay. Yes. Chalo, come on, students. So, the muscles of facial expression, stapedius, digastric, stylohyoid, right? All these muscles are derived from the second pharyngeal arch. Third pharyngeal arch. चलो बच्चों बोल सकते हो third pharyngeal arch, only one muscle. Come on, take this MCQ. Third pharyngeal arch, एक muscle है third pharyngeal arch, मात्र one. There's only one muscle. Name of the muscle? There's only one muscle in the third arch. Any guesses? Any guesses? Come on, students. There's only one muscle in the third arch. That's the stylopharyngeus. 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 Fine. Fourth pharyngeal arch. Fourth pharyngeal arch. All the muscles of pharynx and cricothyroid. And sixth is larynx. Muscles of the larynx. Fine. Palatoglossus. That's fine. Yes, Laksha. बस याद रखना, muscles of the pharyngeal arches, nerves of the pharyngeal arches याद रखना. Anyone which is the nerve of the third arch? Third arch की nerve कौन है? Third arch की nerve है glossopharyngeal nerve. Fourth arch की nerve है internal laryngeal. Fourth arch की nerve है superior laryngeal nerve, and sixth arch is recurrent laryngeal nerve. So first arch nerve is mandibular nerve, second is facial, third is glossopharyngeal, fourth is superior laryngeal, sixth is recurrent laryngeal nerve. Recurrent laryngeal nerve. Okay. Chalo, great. So relations of middle ear cavity याद रखिए, ये कभी MCQs में पूछता है. What are the relations of the middle ear cavity? So what is this? ये है promontory. This is the medial wall of middle ear. ये है promontory. That's tympanic plexus. This is the oval window. इसको बोलते हैं round window. That's a facial canal. Posterior wall. That's a adductus to the mastoid. There's a pyramidal eminence. This is the chorda tympani. Chorda tympani posterior wall से अंदर आती है and gets out at the junction of anterior and the lateral walls. ये chorda tympani यहाँ से आती है and gets out through the junction of anterior and lateral walls. Anterior wall of the middle ear shows two openings. Anterior wall में दो openings है. One is the tensor tympani and दूसरा है eustachian tube. So बस ये याद रखना, anterior wall में दो openings है. One is for the tensor tympani, दूसरा is eustachian tube. Posterior wall में adductus to the mastoid, and there's an area for the chorda tympani. Medial wall पे promontory, tympanic plexus, oval window, round window, and this is the facial canal. नीचे है floor में कौन है? Internal jugular vein. That's a jugular bulb, and roof is formed by the middle cranial fossa. Roof is formed by middle cranial fossa. बस ये कभी आया तो रिलेशंस ऑफ द मिडल ईयर कैविटी आते हैं. रिलेशंस ऑफ द मिडल ईयर कैविटी. रिलेशंस ऑफ द मिडल ईयर कैविटी आते हैं. फाइन है बच्चों? इज दिस क्लियर टू ऑल ऑफ यू? एक बोल सकते हो, thymus is derived from which pharyngeal pouch? Which pharyngeal pouch forms a thymus? या फिर कैन यू टेल मी सेकेंड pharyngeal pouch से क्या बनता है? टॉन्सिल. बस ये इतना याद रखना, थर्ड pharyngeal pouch से बनता है thymus and inferior parathyroids. Inferior parathyroids. फोर्थ से बनता है superior parathyroids. Superior parathyroids. फोर्थ से बनता है. एंड सिक्स से बनती है ultimo branchial body. Ultimo branchial body. These are the pharyngeal pouches. Pharyngeal pouches. So first pharyngeal pouch से बनता है middle ear cavity and eustachian tube. बस ये याद रखना. So first pharyngeal pouch से बनता है, first pharyngeal pouch से बनता है middle ear cavity and eustachian tube. Second pharyngeal pouch से बनता है palatine tonsil. Third pharyngeal pouch, what is formed? This is always asked. Come on, third pharyngeal pouch, thymus and inferior parathyroids. 4th pharyngeal pouch से बनता है superior parathyroids and 6th से बनती है ultimobranchial body. हाँ, ये याद रखना. Just remember this. Okay, बच्चों, Wernicke's area. Come on, students. Now you must be very well versed with this. Wernicke's area is area number 22. Yes, Broca's area 44, 45. Very good. Uncinate fasciculus क्या connect करता है? Uncinate fasciculus connects the Broca's and Wernicke's area. Uncinate fasciculus is known as arcuate fasciculus. ये दो areas को connect करता है. Wernicke's and Broca's area को connect करता है. Fine. Blood supply of the motor area. Answer this. Blood supply of the motor area या फिर sensory area. Yes, students, come on. Blood supply of the motor area. Anyone? There are 2 arteries. 2 arteries है. Students, हमेशा लिखते हैं blood supply of the motor area is middle cerebral artery or the sensory area is middle cerebral artery. But याद रखना, it is not like this. ऐसे नहीं है. See, if you can see this, this is the superolateral surface. Which is this artery here? यहाँ पे एक artery होती है, नाम है middle cerebral artery. So middle cerebral artery supplies this entire surface. And this part, ये जो part है ना, this is supplied by whom? Anterior cerebral artery. This part is supplied by anterior cerebral artery. So, what is the blood supply of the motor or sensory area? There are 2 arteries. There are 2 arteries which supply the motor and the sensory area. One is this artery and one is this artery. So, it will be middle cerebral artery plus anterior cerebral artery. Take this from me, students. Very important MCQ. Very important MCQ. Blood supply of the motor or the sensory area. Yes. Blood supply of the motor or sensory area, 2 arteries है. बच्चों, you will definitely master this MCQ. You will exceed the other students. अगर ये बराबर लिखते हो तो you will definitely exceed the other students. It is MCA plus ACA. बराबर है? MCA plus ACA. लक्ष्य? Okay. And blood supply of the visual cortex, again, इस पे भी double arteries है. One is PCA. The visual cortex is supplied by PCA mainly, but the macula is supplied by middle cerebral artery. Macula is supplied by middle cerebral. So blood supply of the visual cortex is posterior cerebral artery plus middle cerebral artery. Posterior plus middle cerebral artery. Middle cerebral artery क्या supply करती है? Macula. Macula. फाइन है बच्चों, ये याद रखना. यू विल डेफिनेटली स्कोर बेटर मार्क्स देन अदर्स, है ना? बस बाकी सब बच्चे लिखेंगे पोस्टीरियर सेरेब्रल आर्टरी, बट यू आर ब्रिलियंट. यू नो पोस्टीरियर प्लस मिडिल सेरेब्रल, बिकॉज मिडिल सेरेब्रल क्या सप्लाई करती है? मैक्यूला. मैक्यूला इज एन एरिया ऑफ फाइन विजन. फाइन विजन. ओके, विल कम टू द बेसल वेन लेटर. ओके, सर्कल ऑफ विलिस आइडेंटिफाई कर सकते हो? सर्कल ऑफ विलिस, हाँ, आइडेंटिफाई करो. इसके who's this? That's an internal carotid artery. ये कौन है? Middle cerebral artery. That's an anterior cerebral artery. That's a posterior communicating artery. That's a posterior cerebral artery. And ये होगा anterior communicating. Anterior communicating artery. So which artery does not take part in the formation of circle of Willis? Bachcho, come on, can you answer this MCQ? Which artery does not take part in the formation of circle of Willis? Any guesses? Any guesses? Which artery does not participate in the formation of circle of Willis? Yes, come on, come on, Lakshya, Anubhav, कहाँ गए? Swajit. Middle cerebral. Excellent. Middle cerebral artery does not take part in the formation of circle of Willis. Very good, very good. Where's Anubhav gone? Anubhav, break khatam ho gaya. Okay, so that's a middle cerebral artery. ये हमेशा पूछता है the artery which does not take part in the formation of circle of Willis. Your answer, middle cerebral artery. Middle cerebral artery. Okay. Fine. Can anyone tell me this nerve? ये कौन सी nerve है? The only nerve which emerges from the dorsal aspect of the brainstem. The only nerve which emerges from the dorsal aspect of the brainstem is trochlear nerve. Trochlear nerve. The only nerve which arises from the dorsal aspect is trochlear. What is this? ये कौन है? Can anyone tell me what is this circle? What is this one and what is this two? ये फोर्थ वेंट्रिकल है. फोर्थ वेंट्रिकल अगर ये विजुअल स्लाइड आता है, सो व्हाट इज दिस राउंडेड स्ट्रक्चर? व्हाट इज दैट राउंडेड स्ट्रक्चर? बोलो बोलो, कम ऑन स्टूडेंट्स, कम ऑन. लक्ष्य, कैन यू आंसर दिस? अनुभव, व्हाट इज वन? फोर्थ वेंट्रिकल में है अपन, वी आर इन द फोर्थ वेंट्रिकल. व्हाट इज वन? फेशियल कॉलिकुलस. फेशियल कॉलिकुलस. दो कौन है? दो हाइपोग्लॉसल ट्राइंगल. एंड तीन कौन है? वेगल ट्राइंगल. तीन इज वेगल ट्राइंगल. वेरी गुड. ट्राइंगल है बच्चों, वो ट्राइंगल है. न्यूक्लियस उसके अंदर है. न्यूक्लियस इज डीप टू इट. न्यूक्लियस उसके नीचे है. ओके स्टूडेंट्स, व्हाट इज दिस? चलो विल स्टार्ट. व्हाट इज दिस? नंबर 1, दिस इज नंबर 2, दिस इज नंबर 3, and this is number 4. Identify this. This is number 5. हाँ, answer this. ये हमेशा पूछते हैं, ये हमेशा पूछते हैं. ये सेक्शन है ब्रेन स्टेम का. Come on students, come on, come on, come on. थोड़ा सा बाकी है. Come on, a small part is left. Be active, be active, be interactive. Come on students, you can answer this. कोशिश करिए, कोशिश करिए. Try, try, try. Who's number 1? That's a horizontal section or horizontal section of the brain. बोल सकते हो? Yes. Come on students, come on. I'm waiting बच्चों. Guess करो ना, guess करो. Even if it is wrong, that's okay. That's okay even if it is wrong. हाँ, very good. One is caudate nucleus. देखो ये कैसे बहुत अच्छे से आंसर कर रहा है लक्ष्य. हाँ, so one कौन है? one is caudate nucleus. Caudate nucleus. दो कौन है? दो thalamus. दो है thalamus. तीन कौन है? तीन is lentiform nucleus. Lentiform nucleus. चार कौन है? चार is internal capsule. and पांच कौन है? पांच is corpus callosum. पांच is corpus callosum. एंटीरियर कमीशर नहीं है बच्चे वो. पांच is corpus callosum. caudate nucleus ठीक है, thalamus ठीक है, lentiform nucleus ठीक है, internal capsule ठीक है. 5 is corpus callosum. Corpus callosum. Fine है. Yes, there's a message from PW Meded. Next, we have got this Meded 1 plan. You can refer your friends. Okay, bachcho, come on. We go to the next one. Ek beta, what I'll tell you is this. Chalo, can anyone tell me which is this nerve? Chalo, ye bata. I'll just put numbers here. This is 1, this is 2, this is I'll put ABC. A, B, C. This is D, this is E, this is F, this is G. Come on, answer this. What are these cranial nerves? A is third nerve, B is fourth nerve, C is fifth nerve. So this is third nerve, fourth nerve which is attached to the midbrain, fifth nerve is attached to the pons, D is sixth, E is seventh, F is eighth nerve. 9 F G is 12th nerve, 12th. ये होगा H I J. H I J is 9, 10, 11. 9, 10, 11. ठीक है. ये पता है ना आपको? You know this now? अगर नहीं पता है तो बोल दो. If you do not know this, let me know. So now between the pyramids and the olives, 12th nerve. Nerve between the olivus and the inferior cerebellar peduncle, 9, 10, 11. 9, 10, 11th nerve. Okay. Nerve between the olivus and the inferior cerebellar peduncle is the 9, 10th and 11th nerve. Okay, bachcho. Okay. Now tell me, what passes to the middle cerebellar peduncle? Middle cerebellar peduncle से fibers बोल सकते हो? The fibers which pass to the middle cerebellar peduncle. ये पूछते हैं. Peduncles याद रखना, superior, middle, inferior cerebellar peduncle से which fibers goes? Which are the fibers which pass to the middle cerebellar peduncle? Anyone? Fibers passing to the middle cerebellar peduncle are pontocerebellar. That's pontocerebellar. Pontocerebellar fibers. Inferior cerebellar peduncle, बस ये याद रखना, olivocerebellar. हाँ, reticulocerebellar. हाँ, और posterior spinocerebellar. Posterior spinocerebellar. Vestibulocerebellar, olivocerebellar, reticulocerebellar and एक है cuniocerebellar. हाँ, just remember this, बच्चों, इस पे MCQs बहुत पूछते हैं. So what are the fibers which pass to the inferior cerebellar peduncle? Olivocerebellar, afferents, efferents होते हैं. I'm just telling you the main things. Olivocerebellar, reticulocerebellar, posterior spinocerebellar, cuniocerebellar. ये PYQ था. Cuniocerebellar fibers passes to which cerebellar peduncle? Answer, inferior cerebellar peduncle. And what passes to the superior cerebellar peduncle? Superior cerebellar peduncle से tectocerebellar, hypothalamocerebellar. Cerebello-rubral, cerebello-olivary. एक और है cerebello-rubral and cerebello-olivary. Cerebello-rubral, cerebello-olivary. ठीक है, बस ये याद रखना, fibers passing to the various cerebellar peduncles. This you need to remember. हाँ, fibers passing to the various cerebellar peduncles. ये याद रखना. ठीक है बच्चों. Come on, students, coming to the last part of this. Rectus sheath is fine. Branches of abdominal aorta. चलो ये बोल सकते हो, branches of abdominal aorta. Yeah, before that you tell me, what is this opening? What is this opening here? What is this opening? Deep inguinal ring. I'll tell you. Deep inguinal ring is a defect in what? Come on, that's an MCQ. Deep inguinal ring is a defect in dash. Superficial inguinal ring is a defect in dash. Answer this. Deep inguinal ring is a defect in dash. Superficial inguinal ring is a defect in. Chalo bachcho, come on, answer, come on. A last part is left. Be active. Deep inguinal ring is a defect in. Anyone? Fascia transversalis. Deep inguinal ring is a defect in fascia transversalis. Superficial inguinal ring is a defect in external oblique aponeurosis. Very good. Branches of abdominal aorta. Abdominal aorta के branches याद रखना, 2, 3, 4, 5 इसके mnemonic है. चलो बोलो बच्चों, that is 2, 3, 4 and 5. 2, 3, 4 and 5. Answer this. What is 2? 2 are terminal branches. This is always asked. दो कौन है? Terminal branches. What is that? Common iliacs. At what vertebral level is that? L4. So where does the aorta divide? At L4. Where is the IVC formed? L5. IVC L5 पे बनता है. Aorta divides at L4. What are those two branches? Common iliacs. 3 कौन है? 3 are ventral branches. 3 ventral branches. One is celiac trunk. Second is superior mesenteric artery. Third is inferior mesenteric artery. So 3 ventral branches है celiac trunk, superior mesenteric, inferior mesenteric. हाँ, अनुभव कम. Okay, right. 4. What is 4? 4 is lateral branches. Lateral branches. तो फर्स्ट lateral branch कौन है? Inferior phrenic. Inferior phrenic. दूसरा है middle suprarenal. Middle suprarenal. Third is renal. And fourth is gonadal. Fourth is gonadal. So 2, 3, 4, 4, 2, 3, 4, 5 याद रखना. So 4 lateral branches हैं. First is inferior phrenic, middle suprarenal, renal and gonadal. Coming to 5. 5 बोल सकते हो 5. 5 are dorsal branches. 5 dorsal. 5 dorsal branches है. उसमें 4 pairs of lumbar arteries. 4 pairs of lumbar arteries and 1 median sacral. One is median sacral artery. One is median sacral artery. Okay, so 4 pairs of lumbar arteries and 1 median sacral artery. ठीक है, that's okay. Okay. ठीक है बच्चों. So 2, 3, 4, 5 is clear. ये याद रखना बहुत important है. That's very easy. That's what I have made. 2, 3, 4, 5. Clear? Great. तो ये याद रखना branches of abdominal aorta. Fine. Epiploic. Okay, what is this? What is this foramen? What is this foramen? Epiploic foramen. Epiploic foramen के boundaries बोल सकते हो बच्चों. Come on, epiploic foramen के boundaries बोल सकते हो. Superior, inferior, anterior, posterior. Answer this. Boundaries of epiploic foramen. Anyone? Anyone? Come on, come on, come on. Boundaries of epiploic foramen. Question is for you. You can crack this. Crack करिए ये question को. Boundaries of epiploic foramen. Superiorly. Anyone? Superiorly is caudate lobe. Superiorly is caudate lobe. Inferiorly is first part of duodenum. Anteriorly is lesser omentum. Lesser omentum इसमें क्या क्या होता है? Hepatic artery, portal vein, bile duct. Lesser omentum में hepatic artery, portal vein, bile duct. Stomach नहीं होता है बच्चे. Stomach नहीं होता है. Duodenum is there. Posteriorly is IVC. Right suprarenal gland. Right suprarenal gland and body of T12 vertebrae. T12 vertebrae. Body of T12 vertebrae. ठीक है. So anteriorly is less omentum. And less omentum में क्या क्या होता है? Hepatic artery, portal vein and bile duct. So less omentum containing the hepatic artery, portal vein and the bile duct. Fine. So epiploic foramen याद रखना. This is very important. Always asked in the exams. Okay, branches of superior mesenteric artery. Any guesses? Branches of superior mesenteric artery? बोल सकते हो? Branches of superior mesenteric artery is inferior pancreaticoduodenal artery, inferior pancreaticoduodenal, jejunal and ileal branches, jejunal and ileal branches, then middle colic artery, right colic artery, ileocolic artery. Ileocolic gives appendicular artery. Appendicular artery. So inferior pancreaticoduodenal, jejunal and ileal branches, middle colic, right colic, ileocolic. Ileocolic एक branch देती है, नाम है appendicular artery. Appendicular artery. Appendicular artery is a branch of, your answer, superior mesenteric artery. Ileocolic की branch है वो, ileocolic की branch है appendicular artery. याद रखना, that is why this MCQ is important. Appendicular artery is a branch of ileocolic. Fine. Now coming to the branches of inferior mesenteric, इसके 3 ही branches हैं. Left colic artery, sigmoid branches and superior rectal artery. Superior rectal artery. So branches of inferior mesenteric is left colic, sigmoid branches and the superior rectal artery. Left colic, sigmoid branches and the superior rectal artery. Okay बच्चों, retroperitoneal organs बोल सकते हो. Retroperitoneal organs very important, हमेशा पूछते हैं. Retroperitoneal organs, one is kidneys, हाँ, suprarenal kidney suprarenal, then ascending and descending colon, ascending and descending colon, duodenum, pancreas, IVC, aorta, IVC and aorta, and ureters. ये याद रखना, ब्रैच, हाँ, ये याद रखना, हाँ. Which are the retroperitoneal organs? Always asked in the exams. One is kidneys, suprarenal glands, ascending, descending colon, duodenum, pancreas, IVC, aorta, and ureter. Ureter, बहुत important है ureter. Retroperitoneal organs. Fine? Very good. That's fine. Okay, ये मैं बोलता हूँ आपको fetal circulation बोलता हूँ. Fetal circulation. This is very important. Fetal circulation is very important. ये समझ लो. So now you tell me what are the contents of umbilical cord? Contents of umbilical cord बोल सकते हो. There is 2 umbilical arteries and 1 umbilical vein. Which vein is that? That's the left umbilical vein. Left umbilical vein. There are 2 umbilical arteries. 2 arteries है, 1 vein है. Left umbilical vein. This left umbilical vein carries blood. It goes and joins with the left branch of portal vein. That's the lever. That's the portal vein. So the left umbilical vein goes and joins with the left branch of portal vein. Left umbilical vein कहाँ से आती है? Placenta से. If the left umbilical vein goes to the portal vein से blood will go to the liver. So there's a bypass. एक bypass होता है. What is this big vein? That's a IVC. There's a bypass here from the portal vein to the IVC. ये कौन है? Ductus venosus. Ductus venosus. So the left umbilical vein goes and joins with the left branch of portal vein. From the left branch of portal vein, the ductus venosus carries the pure blood to IVC, bypassing the liver. Fine. From the IVC, blood कहाँ गया? From the IVC, the blood goes to the right atrium. Right atrium से left atrium through foramen ovale. Left atrium से left ventricle. Left ventricle से aorta. Aorta divides into 2 common iliacs. Common iliacs divides into an external iliac and internal iliac. And from the internal iliacs, what are these 2 umbilical arteries? So internal iliac से 2 umbilical arteries आती है towards the umbilicus. जब ये umbilical arteries आते हैं, on the way is the urinary bladder. Urinary bladder के दोनों साइड से जाते हैं ये umbilical arteries. बस ये याद रखना, इस पे बहुत MCQs आते हैं. सपोज अगर राइट एट्रियम से ब्लड राइट वेंट्रिकल में गया, राइट वेंट्रिकल से ये पल्मोनरी ट्रंक में जाएगा, पल्मोनरी ट्रंक से लंग्स में जाएगा, बट द लंग्स आर नॉट फंक्शनिंग, सो देयर इज अ बाईपास हियर, दैट्स द डक्टस आर्टेरियोसिस. Ductus arteriosus, so the blood goes to the aorta, bypassing the lungs. What is this, बच्चों? ये है fetal circulation. That's fetal circulation. Now you tell me, after birth, ये fetal circulation. After birth क्या होता है? After birth, this goes off. I'll just write this. This goes off. This is the obliterated left umbilical vein now becomes a ligamentum teres. ये बनता है ligamentum teres. So what is ligamentum teres? ये MCQ आता है. What is ligamentum teres? It's the obliterated left umbilical vein. Ductus venosus का बनता है ligamentum venosum. Foramen ovale becomes fossa ovalis. Ovalis. Ductus arteriosus becomes ligamentum arteriosum. ये सब पता है ना आपको? This goes off. This is the obliterated umbilical artery. ये बनता है medial umbilical ligament. This becomes a medial umbilical ligament. And this is the non-obliterated part of umbilical artery. ये अब बनेगा superior vesical artery. Superior vesical artery. Just remember this. कुछ doubts है तो बोलो इसमें. कुछ doubts है तो बोलो. This is extremely important, बच्चों. This you should know. This you should know. Fine है. So this left umbilical vein after birth becomes ligamentum teres, ductus venosus becomes ligamentum venosus, foramen ovale का बना fossa ovalis, ductus arteriosus बनता है ligamentum arteriosum, obliterated umbilical artery का बनता है medial umbilical ligament, and non-obliterated part of umbilical artery becomes the superior vesical artery. एक बोल सकते हैं what is median umbilical ligament, बोल सकते हैं what is median umbilical ligament. Can anyone tell me this? Can anyone tell me what is median umbilical ligament? Yes, this is the obliterated urachus. Obliterated urachus. क्या होता है ना, in fetal life ये bladder है, that's the urinary bladder. From the urinary bladder to the umbilicus एक connection होता है. From the urinary bladder to the umbilicus एक communication होता है, which we call as the urachus or allantois. From the apex of the bladder to the umbilicus, that's the urachus or allantois. After birth, this connection is gone. This connection is gone after birth, and this is what we call as the median umbilical ligament. हाँ, very good. Yes, Laksha. हाँ, अगर ये yes अनुभव, very good. If this does not obliterate, the child will be passing urine through the umbilicus. इसे हम बोलते हैं weeping umbilicus. Crying umbilicus. Crying umbilicus is due to defect non-closure of urachus. So that is median. What is medial umbilical ligament? It's the obliterated umbilical artery. That's the obliterated umbilical artery. Fine. That's a medial umbilical ligament. Okay. What is this? What is this? अच्छा, एक मिनट बोलो. Posterior relations of kidneys देखते हैं. You get MCQs on the posterior relations of the kidneys. हाँ, posterior relations of the kidneys. इस पे MCQs आते हैं. बच्चों, can you tell me what is this first muscle? What is this second muscle? And what is this third muscle? The first is psoas. Psoas major. Second is quadratus lumborum. And तीसरा कौन है? Transverse abdominis. So psoas major, quadratus lumborum, transverse abdominis. What is this and what is this? This is the medial arcuate ligament. And what's this? Lateral arcuate ligament. Medial and lateral arcuate ligament. What is this nerve? This nerve and this nerve? That's a subcostal ilio-hypogastric ilio-inguinal. Just remember this. बस ये याद रखना आपको. So, what are the posterior relations of the kidneys? पहला मसल आता है psoas major, दूसरा आता है quadratus lumborum, तीसरा आता है transverse abdominis. You get the medial and the lateral arcuate ligament. Three nerves: subcostal, ilio-hypogastric, ilio-inguinal nerve. Now tell me which kidney is lower. कौन सी kidney नीचे होती है? The right kidney. So the right kidney is related to one rib. The left will be related to the 11th and the 12th ribs. ठीक है ना? Left kidney है वो ऊपर होती है. Left kidney is related to the 11th and the 12th rib. The right kidney is related only to the 12th rib. So that's the posterior relations of the kidneys. Just remember this. Okay, can anyone tell me this? Secretory part of the kidney is derived from. Okay, secretory part of the kidney is derived from. Anyone? Yes. Okay, we are coming to the end. Chalo bolo jaldi. Secretory part of the kidney is derived from. This is known as the metanephros. Metanephros. इससे क्या बनेगा? Secretory part, that is urine forming part. ये किससे बनता है? Metanephros. इससे क्या बनता है? Bowman's capsule, PCT, loop of Henle, DCT. Urogenital sinus नहीं बच्चे. Urogenital sinus नहीं. इससे क्या बनता है? Bowman's capsule, PCT, loop of Henle, DCT. So that is secretory part. Collecting part of the kidney is derived from ureteric bud. ये हमेशा पूछना है, याद रखना. Collecting part of the kidney is derived from ureteric bud. इससे क्या बनेगा? इससे बनेगा collecting tubules, duct, major minor calyx, minor and major calyx, pelvis, ureter. Okay, so secretory part of the kidney is derived from metanephron, collecting part is derived from ureteric bud. This is very important, हमेशा पूछते हैं. मतलब collecting part is derived from separate, secretory part is separate. These two parts have to communicate with each other. ये दोनों parts को communicate करना है. If these two parts do not communicate, if the collecting and the secretory part do not communicate, what do we get? We get this. What is this? A congenital polycystic kidney. Congenital polycystic kidney. So congenital polycystic kidney कैसे बनती है? हाँ, trigonobladder is derived from mesonephric duct. बच्चे, mesonephric duct collecting bud से नहीं बनता है, इससे नहीं बनता, वो ureteric bud से नहीं बनता, वो mesonephric duct से बनता है. Trigon of the bladder. अनुभव? Fine. So ureteric bud से क्या बनता है? Collecting tubules, collecting ducts, minor calyx, major calyx, pelvis and ureter. अब ये बताइए structures which emerge from the greater sciatic foramen and re-enter through the lesser sciatic foramen. ये कौन है? There are three structures जो greater sciatic foramen से निकलते हुए they enter into the lesser sciatic foramen. That's a pin. What's pin? Pudendal nerve. This is the internal pudendal vessels. And what is N? Nerve to obturator internus. Pin. Very good. Openings in the diaphragm बोल सकते हो. Openings in the diaphragm T8. Openings in the diaphragm T8 is IVC and right phrenic nerve. Openings in the diaphragm T8 is IVC and right phrenic. T10 is esophagus with vagus, and T12 is aorta, azygous vein and thoracic duct. Right? T8, T10, T12. ये याद रखना. This is very important. ये हमेशा पूछना openings in the diaphragm and all. Answer this. Most dependent part of the body in supine position. Come on, students, you can crack this MCQ. Answer this. Very important. Most dependent part of the body in supine position. बोल सकते हो? Yes, that's the in supine. That's Morrison's pouch. Morrison's pouch or hepatorenal pouch of Morrison. Most dependent part of the body in standing position. PDF मिल जाएगा बच्चे, PDF मिल जाएगा. आर्यन, PDF मिल जाएगा आपको. The team will be sending the PDF or putting the PDF. Most dependent part of the body in standing position. Yes, standing position. In females it's pouch of Douglas. In males it's recto-uterine. Nahi, vesical pouch. Recto-vesical pouch in males and recto-uterine pouch. That's a recto-uterine pouch or the pouch of Douglas. ठीक है ना? Most dependent part of the body in standing position in males and females. याद रखना. In lying position is Morrison's pouch. Dentate line पता है आपको? Dentate line is in the anal canal. That's the watershed line. इसको बोलते हैं watershed line. Watershed line because dentate line के ऊपर and नीचे everything is different. Dentate line के ऊपर the lymph nodes, the lymphatics goes into the internal iliac. Dental line के नीचे the lymphatics goes into the superficial inguinal lymph nodes. Dentate line के ऊपर it's autonomic nerve supply. Dentate line के नीचे it is pudendal nerve. So dentate line के नीचे any inflammations are very painful. Dentate line के ऊपर inflammations are not painful. I mean there's no sensations. Autonomic है. Autonomic. Hilton's line is a line of mucocutaneous junction. Mucocutaneous junction मतलब skin and mucous membrane का junction होता है. That is the white line of Hilton. White line of Hilton. ठीक है? It's a line of mucocutaneous junction. Okay, now just tell me mesonephric duct and paramesonephric duct. ये बहुत पूछता है. I'll write it as male and female. Okay, we'll begin it like this, male and female. What is the mesonephric duct form? Mesonephric duct, ये males में क्या बनाते हैं, females में क्या बनाते हैं? Common, they form the collecting part of the kidney. Collecting part of the kidney, ये common है. जो ureteric bud है ना, ureteric bud. So ureteric bud से क्या बनता है? The collecting tubules, the collecting ducts, the minor calyx, the major calyx, the pelvis, ureter, and now trigone of the bladder. यहाँ पे आएगा trigone of the bladder, collecting part of the kidney and trigone of bladder. This is common, huh? This is common for both males and females. ये common है. Collecting part of the kidney and the trigone of the bladder is derived from mesonephric duct. अब बोलो mesonephric duct, what does it form in males? In males it forms the genital system. मतलब epididymis, vas deferens, seminal vesicles, ejaculatory duct, and mesoderm of the prostate. Mesoderm of prostate. ये याद रखना. In males, the mesonephric duct in male forms the entire genital system of males. Genital system का मतलब testis नहीं, testis is not derived from here, testis is derived from gonadal ridge. तो इससे क्या बनता है? Epididymis, vas deferens, seminal vesicles, ejaculatory duct, and the mesoderm of the prostate. Mesenchyme, the mesoderm of the prostate. Females में this duct disappears off. What is the remnant of mesonephric duct in females? बहुत important है बच्चों, बहुत important है. Answer, what is the remnant of mesonephric duct in females? That's the Gartner's duct. Gartner's duct याद रखना, बहुत important MCQ है. Remnant of mesonephric duct in females is Gartner's duct. मतलब mesonephric duct forms common, ये common है males and females के लिए. Then males में it forms this, females में it degenerates to form the Gartner's duct. ठीक है, बहुत इंपॉर्टेंट है. Remnant of mesonephric duct in females, Gartner's duct. That's mesonephric duct. Now coming to the next, paramesonephric duct. Paramesonephric duct in female forms what? The fundus, body, cervix, fallopian tubes, and the upper 1/3 of vagina. Upper 1/3 of vagina. याद रखना बच्चे, upper 1/3 है. Lower 2/3 of the vagina is derived from urogenital sinus. Sinovaginal bulb से form होता है, urogenital sinus से form होता है. Lower 2/3 of the vagina. Upper 1/3 of the vagina is derived from paramesonephric duct. Males में ये degenerate होता है. Males में ये क्या बनाता है? Appendix of testis and prostatic utricle. Appendix of testis and prostatic utricle. That's in males. ठीक है, that's in males. Fine. Okay. Fine. This is fine. So now coming to the genital tubercle, genital swellings, and genital folds. Males and females. What is the genital tubercle form in males? Genital tubercle in males forms the penis, and in females forms the clitoris. Penis and clitoris. Genital tubercle. ये पूछता है बच्चों, याद रखना. In males it forms the penis, in females it forms the clitoris. Very good, Laksha. Very good. Genital swellings. In male forms the scrotum. In female forms the labia majora. And genital folds in female forms the labia minora. And in males it forms the ventral aspect of the penis. Ventral aspect of penis. Ventral aspect of penis. बस इतना याद रखिए. Just remember this. What is the genital tubercle, swelling and genital fold forms, males and females में? Remember the fate of mesonephric duct and paramesonephric duct in males and females. इस पे बहुत ज़्यादा MCQs पूछते हैं. बहुत ज़्यादा MCQs है इस पे. So just remember all this. Fate of mesonephric duct and paramesonephric duct. Okay. What is the function of primitive streak? Function of primitive streak is formation of 3 germ layers and formation of notochord. That's fine, that's not that important. You tell me, when does the cranial neuropore close and the caudal neuropore close? बोल सकते हो cranial neuropore? Cranial neuropore? हाँ, this is non-fusion of the cranial neuropore. ये कौन है? Anencephaly. Failure of fusion of cranial neuropore. कब close होता है? ये 25th day of intrauterine life. मतलब जो cranial neuropore है ना, that closes by 25th day of intrauterine life. 25th है बच्चे. अगर वो close नहीं हुआ तो what will happen? Anencephaly. And caudal neuropore. कहाँ गया caudal neuropore? Caudal neuropore नहीं है उसमें. Okay, it's not there. And caudal neuropore closes by, so this is cranial neuropore. Cranial neuropore. Huh? Closes by 25th day, and caudal neuropore closes by 28th day. 27th था पहले, अब 28th है. Now it is 28th day. If it does not close, it results in spina bifida. Spina bifida. So cranial neuropore अगर close नहीं हुआ तो anencephaly. When does it close? 25th day. Caudal neuropore closes by 28th है, वो recent है, recent update है 28th. हम 25th 27th बोलते थे, but now it is said to be 28th day. Recent update है. If it does not close, spina bifida. What is this? ये कौन है? This is a sacrococcygeal teratoma. Sacrococcygeal teratoma. This is due to persistence of primitive streak. ये primitive streak normally disappear होता है. If it does not disappear, it results in a sacrococcygeal teratoma. Sacrococcygeal teratoma. ये याद रखना. Okay. Just tell me primary cartilaginous joint. Example बोल सकते हो? एक दो बोलता हूँ मैं. Primary cartilaginous joint. Primary cartilaginous joints के examples बोल सकते हो? The joint between epiphysis and diaphysis. The first chondrosternal junction. Epiphysis, diaphysis, the first chondrosternal junction. These are primary cartilaginous joints. Example of secondary cartilaginous joints. Pubic symphysis, manubrosternal joints. Pubic symphysis, manubrosternal joints. These are second intervertebral joints. ये है secondary cartilaginous joint. Occipitosphenoid. Fine. Fibrous joints, sutures, syndesmosis, gomphosis. वो याद रखना, sutures are found in the skull. Syndesmosis, intraosseous membrane between the radius and ulna, tibia and fibula. And gomphosis is teeth fitting in the socket. Cartilaginous joints, primary cartilaginous, secondary cartilaginous. इनके examples याद रखना. Primary cartilaginous joint, it fuses after certain years. The joint between epiphysis and diaphysis, the xiphisternal joint, the first chondrosternal junction. Secondary cartilaginous joints are midline joints, manubrosternal joints, intervertebral joints, pubic symphysis, secondary cartilages. And then for synovial joints के examples याद रखिए. This is always asked. Pivot is radioulnar joint, atlanto-axial joint. Condylar joint is atlanto-occipital joint, TM joint. Saddle का example बोल सकते हो? Saddle type of synovial joint. Saddle. Sternoclavicular joint. The first carpometacarpal joint is a saddle type of synovial joint. Ellipsoidal बोलो. Ellipsoidal. Example of ellipsoidal joint. Ellipsoidal. Ellipsoidal and condylar are nearly same. Same है वो. Okay, fine. ठीक है. ये types of epithelium है. If it comes, I've given you this types of epithelium. Simple squamous. Simple squamous कहाँ पे होता है? Simple squamous epithelium lines the blood vessels, the alveolus. Blood vessels, alveolus. That's simple squamous. Simple cuboidal glands में होता है. Glands में होता है. Ducts में होता है. Simple columnar GIT. And then pseudostratified ciliated columnar with goblet cells, that's respiratory epithelium. फिर stratified squamous, keratinized, non-keratinized. Stratified squamous, non-keratinized is found in esophagus, the vagina. Stratified squamous, keratinized is found in skin. Stratified cuboidal columnar is found in the ducts of the glands, and transitional epithelium is found in the urinary system. That's transitional epithelium. हाँ तो ये देख लो. Okay, can anyone identify the slides? चलो, what is this slide? बोल सकते हो? Stratified squamous non-keratinized epithelium, you get submucous glands. That's a slide of GIT. GIT है. मतलब पूरे GIT में what is the epithelium? Simple columnar except esophagus. Esophagus का epithelium कैसे है? Stratified squamous non-keratinized epithelium plus you get the submucosal glands. This is esophagus. अगर slide आता है तो very good Anubhav. Tell me what is this? Yeah, villus है villus. So villus, that means small intestines. Villus with glands in the submucosa. ये है Brunner's glands. Villus with Brunner's glands, that is duodenum. ठीक है. So villus दिख रहा है मतलब small intestine है. Villus and you get glands, that's the Brunner's gland. So this is definitely duodenum. Fine. Simple columnar epithelium, gastric glands दिखते हैं. You get this chief cells and parietal cells. So this is the fundus, stomach. Fundus. मतलब if this histological slide comes for identification, how do you identify that? I'm telling you. हाँ? तो ये है fundus of the stomach, colorful slide है, chief cells, parietal cells है, simple columnar epithelium दिखता है. Okay, so this is stomach pylorus. Again, simple columnar epithelium, gastric glands, gastric pits deep होते हैं. This is villus. Again, ये villus है. Villus यहाँ पे pairs patches है. Villus with pairs patches कौन है? Ileum. देखो बच्चों, villus है मतलब small intestine है. Villus with pairs patches होंगे तो ileum. Villus with Brunner's gland है तो duodenum. And villus with nothing specific, that is jejunum. Villus दिखता है, villus मतलब small intestines, बराबर है. Villus with Brunner's gland, that's duodenum. Villus with pairs patches, that's ileum. And villus with nothing specific, that is going to be what? Jejunum. That's how you remember. Okay, what is this slide of? ये बहुत easy है. बोलो, what is this slide of? You get cortex, medulla. Cortex में you get different stages of a developing follicle. That's the ovary. Very good. What is this? This is a seminiferous tubules. You can see different stages of developing sperms. Tails दिख रहा है center में. This is testis. Seminiferous tubule. That's a seminiferous tubule. You see different stages of developing sperm here. Fine. This mucosa is folded. Epithelium होगा simple columnar with cilia. This is fallopian tube. Fine. You get glands here. This is a fibromusculoglandular organ. इसमें ना the glands are involuted. The glands are folded like this. The glands are folded and इसके अंदर concretions होते हैं. इसके अंदर secretions होते हैं. This is a prostate. Fibromusculoglandular organ. Fibrous tissue, muscular tissue, glands होते हैं. Glands show involution, folded होते हैं, and उसके अंदर होता है concretion. So that is going to be prostate. Okay. This is having a small lumen, pseudostratified ciliated with ciliated stereocilia, ciliated columnar epithelium with stereocilia and a thick muscle coat. सबसे thick muscle coat होता है. That's vast difference. A very small lumen and a thick muscle coat. That is vast difference. You can see this is the capsule. This is zona glomerulosa, zona fasciculata, zona reticularis, and that's the medulla. This is adrenal gland. तीन layers दिखते हैं. Zona glomerulosa, this is zona glomerulosa, this is zona fasciculata, that's zona reticularis. So that is the slide of fallopian. That's a slide of adrenal gland. adrenal gland. Fine. What is this? ये बोल सकते हो? Star-shaped lumen. Anyone? What is that slide? A star-shaped lumen with transitional epithelium. That's going to be ureter. And यहाँ पे hyaline cartilage दिखता है. Hyaline cartilage, and the epithelium is pseudo-stratified, ciliated, columnar with goblet cells. So that's respiratory epithelium. What is respiratory epithelium? It's pseudo-stratified, ciliated, columnar with goblet cells. You get hyaline cartilage, you get glands, you get muscles. This is the trachea. Trachea. Okay. What is this? ये सबसे easy है. This is a classical hepatic lobule. ऐसे six-sided होता है hepatic lobule. You get central vein. Periphery पे you get portal triad. What is that slide of? What is this slide of? This is a slide of liver. You get Kupffer cells. You get hepatocytes. You get sinusoids. That's liver. This is a characteristic umbrella-shaped cells. This is a transitional epithelium. And there's a large number of muscles. So transitional epithelium with large number of muscles. That's a urinary bladder. What is this? Can anyone identify this slide? Yes. Yes, Amit. Very good, very good. Amit, very good. Anubhav, yes. कोई ये slide बता सकता है? Answer this. Last slide. ये ना serous acinus है. अगर serous acinus देखते हो ना तो we feel it's a serous salivary gland. But very good, Lakshya. What is this? These are the islets. Islets. So serous acinus plus islets. This is going to be the pancreas. Pancreas. That's a slide of pancreas. Pancreas के दो parts हैं, exocrine and endocrine parts. So exocrine part is serous acinus, endocrine part is islets of Langerhans. So this is going to be pancreas. Okay. I hope students, it was an exhaustive lecture. I hope these things are all clear to you. Sub important topics cover kiye hain. Just go through this, revise this, and next, 29th is your exams, right? Keep on revising this. Keep on revising this. Keep on revising this. Some PYQs and everything I have covered in this. Sab kuch cover kiya hai. I hope everything is clear to all of you. Thank you so much, my dear children. Thank you and all the very best from the entire team of PW. We have taken a lot of efforts for you. Okay, so from the entire team of PW, once again, wishing you all the very best and come with flying colors, and we'll meet for a special interview of yours. Okay, thank you. Bye-bye. 28th, yes. Why 28th? Next to next Sunday. Fine. See you then. Bye-bye. You've been all answering very well. बहुत अच्छे से आंसर किए हैं सबने. You have a good confidence. You have good content matter. Only thing is that revision is necessary, and be fresh for the exams. Read the questions properly. Answer them. Okay. Thank you. Bye-bye. I'll stop here.